Good morning, everybody. Welcome. Thank you so much for being here. Excellent. You can welcome. Thank you so much for being early and for being on time. What I'll ask you to do, we're going to give it a few more moments. Follow Dawn's excellent and informed example. Please type your name and where you're from, where you're working from. And if you're not working, that's fine too. Just let us know your name and where you're from, and type that into the chat. And if you happen to be sharing your computer, yesterday we had some folks who were sharing their computer with other people who were participating. Thanks, Craig. Please make sure that you type their names, and if they're from the same place as you or a different place, type that in the chat too. Because again, we want to make sure, as you know, this is a 3-part, 2 hours, 2 hours, and 2 hours. And I will say this now, but I'll also say it later. In order to receive credit, you need to attend the full 6 hours. There's no partial credit. We can't give you partial credit for attending one part and missing another. So just please factor that in and know that in order to get the full 6 hours, you have to be present for the full 6 hours. There's no partial credit and there's no makeup credit. So we're not able to make it up because it's within our unique learning community. So again, thank you so much for being here. I'll repeat that again as more people join us. We have 36 people in the learning community. We'll give it just another couple of moments, and then we'll go ahead and get started into our first 2-hour installment of the theory and practice of motivational interviewing. Thank you for being here, and I'm looking forward to our conversation and our practice together as a learning community focused on the evidence-based practice of motivational interviewing. And I think we should go ahead and officially get started. It's possible that a few more people may join us. Thank you, Cynthia. For those of you who I haven't had the opportunity to be in a learning community conversation with before, I want to send you through Zoom a very warm welcome and thank you for being here. For those of you whom I've had the great privilege to be in a learning community conversation with prior to this, welcome back. And thank you so much for making the time to be here for this 3-part adventure focused on the theory and practice of motivational interviewing. And my hope is that it will be an adventure for all of us, because we're a unique learning community of 40 people at this particular moment, and hopefully we will continue to be 40 strong through part 2 and 3 as well. I am currently a research project director at the New York State Psychiatric Institute. I'm also a senior staff trainer for the Northeast and Caribbean Addiction Technology Transfer Center. I'm also a social worker and a member of MINT. And is there anyone within our learning community who knows what MINT is? And I will give you just a heads up, it is not a breath mint social club. But does anybody know what MINT, M-I-N-T, is or stands for? And is anybody else in our learning community a MINT member? Because that's possible. So does anybody know what MINT is or what it is? Would you like to unmute and share? Tammy's like, nope, I don't. I'm not sure. I thought it was a breath mint social group. I would go for spearmint, not peppermint. I like peppermint, but I like spearmint better. MINT stands for the Motivational Interviewing Network of Trainers. It's an international organization of people who belong to this particular group, who train motivational interviewing and coach people and code people on their practice of motivational interviewing. Because one thing to keep in mind, folks, Celeste, you were going to say that, weren't you? Yeah. You know what MINT is, yes?
So I do work full-time at a company that utilizes motivational interviewing to talk about advanced care planning for terminally ill patients.
Okay.
And I have had supervisors who are MINT certified. And when you said coding and everything, I just nodded my head because my work is always recorded and we are coded. We're given a score of how we're doing and how much motivational interviewing we are utilizing.
Yeah.
And I work part-time as a drug and alcohol counselor. So a lot of that knowledge that I have, I apply to the drug and alcohol counseling field when it comes to motivational interviewing. And I
Fantastic.
love it, actually. It's really great.
Fantastic. Thank you, Celeste. And I want to underline a couple of things that Celeste said about Mint, which is one, Mint supports the refinement and the faithful implementation of the evidence-based practice of motivational interviewing. Let me underline that motivational interviewing is evidence-based and it is verifiable. And Celeste has referred to that by saying that her recordings, her conversations are audio or video, probably audio recorded. And then a trained coder can listen to that conversation using a validated instrument. And I'm not sure, yeah, MINT stands for Motivational Interviewing Network of Trainers. Tammy. Yeah, Motivational Interviewing Network of Trainers. So the takeaway there, folks, is that you can practice motivational interviewing and actually get feedback and refine your practice based on what this coding system basically says. And Celeste, I'm not sure which instrument your team uses. I'm going to guess, though, that it's probably the MITI, the MITI. Am I correct in that, or am I mistaken? Do you know which instrument you use? You're not sure. Not sure. Okay. I'm going to guess that it's probably the MITI. And if you're interested, you could Google MITI and you will get a link that will show you that particular coding instrument. And I'll say a little bit more about that later. But since Celeste is so informed and experienced, I'll just underline again, folks, that the practice of motivational interviewing is verifiable and it's codable. And the only reason that you would verify or code somebody's MI practice is really twofold. One, because you want to make sure that the person gets feedback on the strengths that they're bringing to the conversation, the skills they're using, the strengths they're employing, and if there are opportunities for specific refinement of their practice. And some of those refinements are relational and some of them are technical. That this instrument actually separates those things out. So I'll give a very concrete example and then we'll go forward with the logistics. Let's say Celeste does an audio recording. It's coded. Celeste gets feedback. A lot of strengths are identified. And one of the growth opportunities is that the ratio of questions to reflections is that Celeste is currently asking actually more questions than offering reflections. The instrument will show that. That's a technical skill. And I know we're going a little bit into the weeds, but I want you to understand that there are weeds. We're going to come out of the weeds and we're going to have a little bit more of an overview before we go into the weeds again. But just to stick with the weeds for a moment, the feedback for a growth opportunity that Celeste gets is, based on the coding, we noted that you asked 15 open-ended questions during the conversation, and you offered 5 reflections. Now, when you're practicing motivational interviewing, and I'm going to put that in quotes, folks, and I'll explain why I'm putting it in quotes. when you're practicing motivational interviewing, ideally, you're offering more reflections than offering questions. You're actually reflecting more than questioning. So that would be an opportunity. If I had the opportunity to be coaching Celeste, I would say, well, let's talk about how you could turn some of your questions into reflections, or how you could incorporate more reflections. And again, this is the last point, and then we're out of the weeds for a moment. The benefit of doing more reflections than questions, just so we're clear about the purpose, is that it creates greater understanding and it strengthens the rapport in the relationship. So offering reflections builds rapport and creates understanding between the worker and the patient or the client. So that's the reason that we code for that ratio of questions to reflections. Okay, I know that was way into the weeds, way at the beginning, and we're going to come out of the weeds for a moment. And my hope is that at the end of our 6 hours, not 6 hours today, only 2 hours today, but at the end of our full 6 hours, that everybody in this learning community will have a very rich understanding of this evidence-based practice and what is called an MI consistent approach or MI spirit. Those are the two primary goals of this 6-hour learning community conversation, that you understand the relationship between MI spirit and an MI consistent approach and the practice of motivational interviewing. They are related and they are different. Okay? So my hope is that you're going to have a very strong understanding of all of that. There are now 49 people in the learning community, which is fantastic. So glad that you're all here. I hope that all 49 of us, or 48 of us now, somebody just dropped out. Hopefully they'll come back. All 48, hopefully 49 of us will be in this 6-hour learning community adventure over the next few days. Okay? One final thing I will tell you by way of introduction. I'm a social worker by training. I'm a graduate of Hunter College School of Social Work. I began my social service career in 1991, providing direct services at that time to people living with HIV and AIDS. And I did that work that direct service work until 2003, where I made the transition into predominantly workforce development, training providers and supporting providers through technical assistance. So I was providing direct services during the height of the HIV pandemic. And then in 1996, of course, we got another class of antiretroviral drugs that significantly cut the death rate in the first year, which was 1996, by a full 50%. And imagine the impact of that, folks. In 1996, because of the development and the availability of a new class of antiviral drugs for HIV, for managing and suppressing viral replication, 50% of people's lives were saved within that first year. It was an extraordinary turning of the tide in the pandemic around HIV and AIDS. And I was very fortunate to be working in New York City at that particular time in that particular area, and had not started my journey with motivational interviewing yet. So very, very happy to be in this learning community with each and every one of you, and very much looking forward to our work together over this 6 hours. I'm going to share my screen. We'll take care of a couple of logistics. In the first one, we'll be confirming the dates of our ongoing conversation. Now, I just want to invite everybody, now there's 53 of us. What I'm going to ask you to do is please use the chat right now to confirm by typing the letter Y that you can see the slide and see me. I can't see you, but hopefully you can see the slide and see me. And let's get a Y, the letter Y, from all 53 of people.
I'm leaving this on and I'll be right back.
Okay, great. Very good. All right.
I don't have my wallet with me.
Yeah, and just
bring it to you,
I
okay?
just want to let you know
later.
you're unmuted. I don't know who that
Soon?
I don't know who that is speaking, but you're unmuted at this particular moment, and we're finding out all kinds of information about your wallet. But hopefully not your checking account number. All right. So I'm going to go back and share my screen again, and we'll cover that in a minute. We'll cover some of the logistics about that. So this is the theory and practice of motivational interviewing, just so you can be sure that you're in the right place. Today is July 10th. We will meet next on the 15th and then again on the 18th. Now, I will repeat and confirm at this particular time, and I'm going to ask you to use the chat again to confirm that you understand this. This is a 6-hour learning community conversation. In order to receive the full 6 hours of credit, you must be present for the full 6 hours of credit. There are no exceptions. If you miss the 15th and you come back on the 18th, you're more than welcome to stay. You will not receive credit for the 10th or the 18th. There's no partial credit and there's no makeup credit. So in order to receive the credit hours, and not everybody's here for credit hours, I imagine maybe 52 of you are here for credit hours. There could be others who are not. I'm kidding. People come to learning community conversations for many reasons. And whatever the reason you're here for, I'm glad you're here and I'm looking forward to our conversation. I do need to confirm, though, and do need you to confirm that you understand this, that you must be here for the full 6 hours. There is no partial credit and there is no makeup credit. So by typing the letter Y in the chat right now, you understand that agreement and you are confirming that agreement. So just so that we're all on the same page in regard to that. And so far, 18 people have typed the letter Y in the chat. And part of the reason for that, folks, is that we don't do makeup because the learning community is what it is. There are 53 of us in this learning community, and we can't recreate that learning community for your makeup opportunity. So that's why we don't do a makeup. And the course is approved for 6 hours of credit under this particular title. Okay, Jen, that's fine. And Jen just shared a message with everybody. I don't know if it's meant to be with everybody, but Jen just shared the message that on the 15th, Jen is going to miss 1 hour, but doesn't need the credits. And Jen, I'm so glad you'll be with us for the hours that you'll be here. And I'm glad that the credit is not a problem. And thank you for letting me know that. So this learning community conversation, although the title of the course is Theory and Practice of Motivational Interviewing, will be unique to our learning community because, as Celeste just demonstrated, you will bring your unique knowledge and understanding to this. You will bring your experiences to this conversation. This conversation and this focus on this evidence-based practice is meant to support and be relevant to the realities of your work. So what we talk about, what we practice, what we focus on will be related to motivational interviewing. It may not reflect the official positions of our funder, and that's okay because it's meant to be supportive, relevant, and meaningful to your work. We are a learning community. There are 54 of us now in this learning community. How we talk to each other, the language. Yes, and Glenn, to answer your question, you will get the PowerPoint at the conclusion of the 6 hours, and you are free to use it and share it in any way that you like that benefits you or your colleagues or your organization. You're most welcome. We are a learning community of 54 strong at this particular moment. How we talk to each other, especially in regard to the practice of motivational interviewing and an MI consistent approach and MI spirit, the words we use matter. They have power. And in our learning community, we want to intentionally be using language that is inclusive, respectful, and welcoming of all 54 of us in this learning community. We, in this learning community, will put people first. That is an expectation of participation in this particular learning community conversation, and particularly relevant to the topic of motivational interviewing and the practice and spirit of MI. PowerPoint has now made it verbally. Yeah, Forrest, well said. Words do hurt and they can hurt, and we want to make sure that we are paying close attention to that. PowerPoint, as I said, makes it official. Welcome, exclamation point. If at this point you have already typed your full name and where you're from in the chat, thank you. If you have not done that, please do it now, because we need a timestamp record of your presence and participation in this conversation. That is what we base issuing the certificate on. So if for some reason you don't type your name in the chat, we don't have a record of your presence. So make sure, if you haven't done so, that your full name is typed in the chat and where you're from. If you're sharing your computer with anybody, please type their names in the chat too. There will be a brief evaluation that everyone will be asked to complete at the end of part 3. Please complete that evaluation. Once we receive it, in about 2 weeks, we will send you your certificate of 6 credit hours, and we will also send you a copy of the slides. Excellent. Couple of additional guidelines in regard to the language, the words that we use. When you registered for this 6-hour adventure, you actually agreed to have a working camera and a working microphone and to be on camera for the full 6 hours. Now, having said that, if you need to step away for a moment, somebody I believe is unmuted, and we'll get to muted or unmuted in just a moment. But one thing I will acknowledge is that if you do need to step away for a moment during our learning community conversation, that's fine. Just send me a private message saying that you'll be right back. You can even just type BRB. Just let me know that, turn off your camera, step away. Stepping away for a moment means 1 or 2 moments. It doesn't mean 30 to 45 minutes or an hour. That's stepping out. That is not stepping away. If you step out, you are no longer present and are not eligible to receive the credit. And Zoom monitors that. So just so you're clear, if you do need to step away, just send me a private message, be right back. And when you come back, turn your camera back on and jump right in. Okay? Muted. There are 54 of us. We're vacillating between 53 and 54. I'm going to ask, unless there's something that you want to comment on, unless there's something you want to ask, unless there's information you want to share, if you wouldn't mind remaining muted. If there's something you want to say, a reaction you want to share, information, a comment, a question, do not hesitate to unmute and do that. I personally do not mind being interrupted at all. You are free to interrupt me at any time. Just say, hey, Paul, I want to add something here, or I'd like to contribute something. You're more than welcome to do that. I would ask, though, if Celeste or anybody else in the learning community has the floor and they are making their point, that you not interrupt them, that you wait until they have made their point, and then you're more than welcome to unmute and say or add whatever you'd like to add. Okay? What I would also say is that our goal here, okay, so I'm getting some private messages about camera. Thank you for letting me know. That's great. And again, thank you for letting me know that. Again, keep in mind that when you registered for this course, you registered for this course, not this course and working at the same time, or this course and being in another meeting at the same time. I think it's very difficult to certainly practice motivational interviewing or focus or be a member of a learning community if you're doing two things at the same time. So I invite you to consider that. It may have been unavoidable or may be unavoidable, but I would ask you to consider that. Your presence is requested and your participation is required in order to receive credit for participating and being part of this learning community. So just keeping that in mind, and you know, we're a learning community of adults, and you are invited to exercise your own autonomy in regard to that. We may or may not always agree on what's being said, what reactions we may have, and that's perfectly okay, because this is a robust and living learning community. The goal is to be able to listen to and hear what you may or may not agree with and still offer respect. And the last guideline that I would ask is, please speak from the I. I feel this, I know this, I believe this. So those are the additional guidelines in terms of the language. I'm going to advance the slide and then take my slides down for a moment and just simply ask, can everybody agree to those guidelines as stated? And you can wave, nod, throw money, give a thumbs up. But I ask for your acknowledgement that you accept those guidelines of our learning community. Or you can type yes in the chat. You can follow Tony's excellent example. Fantastic. Those are the guidelines. Yep, excellent. Ooh, Sabrina, I think you have a Mac, don't you? Because Mac does all these cool things. So very glad that you're here. And thank you so much for being here and for your participation. I'm going to share my screen again, and thank you for your confirmation on the guidelines. Excellent. So we will now review the goal of this course. And actually, before I show the slide, I'll just say this verbally so you can see me. Well, you can see me even when the slide's up, but I can't see you. What I want to emphasize here, folks, a lot of training on motivational interviewing, and I'm very curious, and you can use the chat to respond to this or not. You can type a Y for yes, and let me ask the question first. You can type a Y for yes, you can type a U for unsure, you can type an N for no. But I'm going to guess that a number of people have been in prior MI trainings. And if you've been in a prior MI training, type Y in the chat for yes. If you're unsure, type a U. And if this is your first MI training, type an N in the chat, meaning you've never been in MI training before. Okay, so I'm seeing a couple of never been in MI training before. I'm so glad you're here. So glad that you're part of this learning community. And for those of you who've been in MI trainings before, I want to underline that a lot of MI trainings focus on OARS. They focus on OARS, the core communication skills that are associated with the practice of motivational interviewing. And yes, that's a part of MI. I have a shocking revelation to share with everybody, though. Bill Miller and Stephen Rolnick, the creators of motivational interviewing, who just published a couple of months ago now, the 4th edition of their book, Motivational Interviewing, Helping People Change and Grow, did not invent the open-ended question, the affirmation, the reflection, or the summary. They did come up with a very catchy acronym, ORS, not these kind, but the core communication skills. They did come up with a very catchy acronym to remember the core communication skills, the tools we use when we're in conversation, whether we're practicing motivational interviewing or not. And the point of my mentioning that, folks, is a lot of MI training spends a lot of time focusing on the core communication skills. The core communication skills do not equal the practice of motivational interviewing. They are the tools we use if the practice of motivational interviewing is warranted. Another shocking revelation, possibly for some, is that the practice of motivational interviewing is not appropriate for every conversation that we have. I'm going to repeat that because my hope is that will be the takeaway message from part 1 for you. That the practice of motivational interviewing is not appropriate for every conversation that we have. Associated with that is that an MI consistent approach, MI spirit, is appropriate for any and every conversation that we have. I'm going to repeat that again. An MI consistent approach, MI spirit, is appropriate for any and every conversation that we have. Now, the question I want to pose before I say a little bit more about the goal of our topic together is those two statements together. The practice of MI is not appropriate for every conversation. An MI consistent approach, an MI spirit, is appropriate for any and every conversation that we have. What does my putting those two statements together communicate to you? And it may communicate confusion or mystery, but my question to you is what do you make of those two statements? And I invite whoever would like to unmute to comment on that. What do you make of those two statements that I'm putting together on the same plate for us to look at the very beginning of our conversation? The practice of MI. Go ahead, Craig. Go ahead, please.
I was just going to say, it says to me that you have to be an active listener. You have to decipher based on that individual what's appropriate.
Yes. And can I just say, can we all give Craig a round of applause? So Craig, thank you for starting us off with that. And I love the fact that you are bringing in active listening, and to really underline with a fine point, Craig is saying we need to tune our listening, and tell me if I'm going too far, Craig, that we need to tune our listening so we can discern, we can differentiate between what's appropriate at this particular moment in the conversation. Am I getting that right, Craig?
Yep, according to what the individually for each person.
Fantastic. Does anybody, Craig, thank you so much. Does anybody else want to comment on putting those two statements? Practice of MI is not appropriate for every conversation. An MI consistent approach, MI spirit, is appropriate for any and every conversation you have. Val says respect and learning skills. Excellent. Thanks, Val. Thanks for adding that. Any other thoughts about Samantha? What do you think? You have a very thoughtful look on your face. And please, if I invite you to comment, if you want to pass, if you don't want to say anything, this is our learning community. You're always welcome to pass if you would rather not comment. Go ahead. If you're willing, Samantha.
Yeah, I'm willing.
Okay.
So to me, it says that like motivational spirit or motivational interviewing spirit is more of like an energy you bring to a conversation and like skills you bring, where motivational interviewing is more like structured, I guess.
Fantastic. And again, Samantha, thank you for bringing this word, the energy you bring to the conversation, a very insightful way of kind of quantifying or clarifying what an MI consistent approach, what MI spirit is versus the practice of motivational interviewing. And I love the word that you also use, Samantha, structured. And Samantha, tell me if you're okay if I add this word, and you can reject it if you don't like it. But structured, yes, double thumbs up on that. Also, technical. Are you okay with that? And I'm going to try for 3 out of 3. Tell me if you're okay with this word too. Structured, technical. I got a thumbs up on those two. I'm keeping my fingers crossed. Also intentional. You okay with that? Okay. All right. So the practice of MI, structured, technical, intentional. MI spirit, MI consistent approach, energy you bring to it, approach. Any other thoughts about those two ideas on the same plate? And Samantha, thanks for jumping in and accepting my invitation. But again, I want to reiterate, you can always pass if you don't want to comment. Any other thoughts about the practice of MI is not appropriate for every conversation. An MI consistent approach, MI spirit, is appropriate for any and every conversation you have. Thoughts, reactions to those two ideas?
I was just going to say, to me, that means like not every interaction has to be clinical, but you can use those tools in everyday life.
Yeah. And Jonathan, thanks for opening it up to the fact that we can use those tools in everyday life. And, Jonathan also prompts me to want to add something else. And this may sound familiar to you, Jonathan. I want to also add, because Jonathan is absolutely right, it doesn't always have to be clinical. You do not need to be a clinician or have an advanced degree to practice motivational interviewing or to engage or bring the spirit or the energy of an MI consistent approach. You don't need to be a clinician. So if you're in this learning community conversation and you're not a clinician, you're in the right place. If you're in this learning community conversation and you are a clinician, you're in the right place. So anybody can learn how to practice motivational interviewing. It requires 3 things, though. 1, it requires practice. You actually have to do it. You can't just talk about it. 2, it requires reflection on your practice. You have to look at what you did, and Celeste gave us a great example of that at the beginning about audio recordings. That is a form of reflecting on your practice, even if it wasn't being coded. If Celeste recorded her conversations and she listened to them again afterward with an MI consistent approach, MI spirit hat, and the practice of MI hat on, that would still be a form of reflection. And the third thing that's necessary is, am I informed feedback? And Celeste also referred to that. There are people that code her conversations. They have training. They have am I informed understanding? And they are able to give am I consistent feedback to help refine the practice. Forrest wrote in the chat, it says to me that that it is nonlinear as well. There's no particular way that it has to go either. If I had a small fund that I could send out to people for the comments they share, I would be sending Forrest and everybody else a small check in the mail. I do not have that fund. So Forrest, you are not getting a check. But I just want to be clear about that. But I want to thank you for what you typed in the chat, $, $. I want to thank you for that, because there is a misconception about motivational interviewing. The practice of motivational interviewing is that there's one right way to do it. That is a misconception. There is no one right way, and there is no script. I've had many people say, I will practice motivational interviewing. Just tell me what I need to say. Well, we can't decide what we're going to say until we hear what the client or the patient says, because what they say informs what we may reply, what skill or tool we may use. So Forrest, you are so right on the money by there is no particular way that it has to go. What I will add to what Forrest's insight shares with us is that the practice of MI is directional. And I see some heads nodding in regard to that. The practice of MI is directional, and more will be revealed in regard to that. So Forrest, thank you for putting that in the chat. Marissa writes in the chat, if you really think about it, most, not all clients are coming to us with the desire to change something. And us bringing that MI energy, and Samantha, your phrase is catching on, MI energy, I love it. Bringing that MI energy in the room, it confirms that. In my experience, the non-linear approach, which Forrest is referring to, thank you, Forrest, has worked better with the clients I work with. Yes, because, and I love the fact that Forrest and Marissa are framing it as non-linear, because folks, linear implies A to B to C to D to change. Change is, yeah, I see it on your face, Forrest. Change just doesn't go that way. Change is a process, and it does not go that way. So the fact that we have MI consistent approach, MI spirit as the energy we bring, the fact that there's no one right way to do this, and don't let this overwhelm you, folks, because it can start to feel overwhelming. Well, if it's not linear, what the heck do I do? Trust me, there's guidance in regard to that. And that guidance comes in the form of what is called the 4 tasks. And we will get to the 4 tasks as we go forward. I don't want to jump too far ahead. Okay? We still have 4 more hours after this 2 hours. I have to parse this out. Okay? So one final thing I'm going to say before I share the next slide. One final thing that I will add. If you've been in MI training before, as I said several moments ago now, there's often a special emphasis on OARS, O-A-R-S. the core communication skills. This learning community conversation is not emphasizing those core and basic communication skills that you, as people who talk to other people, use on a daily basis. We will touch on open-ended questions, affirmations, reflections, and summaries in terms of how they're defined in the practice of MI. I am confident that everybody in this learning community has probably within the last 24 hours used an open-ended question. I'm confident that you may have even offered a reflection or a summary or an affirmation. We are going to touch on them. This learning community conversation, our 6 hours together, is about understanding the actual practice of motivational interviewing and how we bring that energy that Samantha is identifying, how we bring an MI consistent approach, how we bring MI spirit into the practice of motivational interviewing. That's our emphasis. We will touch on ORs, but we're not going to spend all our time on it. I want to, before I show you the next slide, Forrest says, I'm noticing that you have been using the practice of high vibration since we started. Forrest, I'm not exactly sure what that means. I've never heard that before. What is high vibration? I'm intrigued. Go ahead.
That good energy, that's high vibration.
Oh, okay. Okay. Got it. So we can add to Samantha's framing of energy. Let's also attach this idea of like, it's a high vibration. It's that good, positive energy. And Forrest, I'm going to say this and tell me if I've gone too far. It's energy that its intention is to offer respect and to engage. Is that a fair description of high vibration?
Exactly. Even with you now just asking me if it's okay to reframe what I just said is high vibration.
Okay. Fantastic. Thank you so much, Forrest. Solana writes, Solana, you are so kind. Paul is my hero. He definitely has that high vibration. Your check is in the mail. No, I'm kidding. I know you were not paid to say that. So folks, I want to share an example with you of what I'm going to, from this point on, I'm going to continue to refer to something that we can maybe embed in our mind, which is client or patient speech. And what I mean by that is what the client or the patient says to us. Okay? Client or patient speech. Sometimes that's referred to, and Celeste, this may sound very familiar to you as someone who's done recordings and it's been recorded. Sometimes that's referred to, folks, as an utterance. It's what the patient says, and then we as the provider may offer a provider's utterance. But I'm going to refer to it at this moment as client speech or patient speech. Let me set the stage for you. I'm in a conversation with a young gentleman who is considering cutting down the amount of weed that he smokes on a daily basis. This is something that he's considering. Now, I would imagine many of you are familiar with the concept of harm reduction. He did not say, I am considering stopping smoking weed. He says, I am considering cutting down the amount of weed that I smoke on a daily basis. That could be framed as a harm reduction goal. So that's what he's considering. And this is what he says to me. Well, you know, I only smoke weed on a daily basis because it's how I feel comfortable in my own skin. I hang out with my buddies at lunch. I meet them. We get together. We smoke a little bit. And it's how I socialize. My boss has also told me that if I'm back to work late one more time from lunch, he's going to fire me. My girlfriend has also said that when I'm stoned, I'm belligerent and I don't treat her with respect. That's what the client, the patient just said to me. That's the client's speech. Okay? That's their utterance. Okay? Now, I'm going to pause here for a minute, and I just want to ask, anybody have any thoughts or reactions to what the patient, the client just told me? So does anybody have any thought or reaction to what the patient just told me? And I want to go back to what Craig said earlier, because I'm hopeful that your ear is tuning into what the client said, the language that the client offered. And that and Craig, I think I'm using your words when I say this, that you're actively listening to what the client said. So my question is, any thoughts or any reactions to what the client just said? And yeah, go ahead, Jonathan, please.
Oh, I would probably start with not, I don't think congratulating is the right word, but like acknowledging he's recognizing that there's a problem, acknowledging his shortcomings. But my focus would probably, I would probably try to zero in on what he said about not feeling comfortable in his own skin when he's sober, and try to get more insight on what that's about.
Okay. Okay. Excellent. Thank you. And before we go to Forrest, I just want to acknowledge that Nikki writes in the chat, or Solana writes in the chat, he's aware and willing to prepare for change. Nikki writes, it sounds like the client has several of their own sources of motivation to cut back. Okay. Carol says he is open to change. Chrislyn says, and hopefully I pronounced that right, making the decision to use yes. Terrence says he recognizes the possible consequences of his job and relationships. Solana also adds, ask him about other hobbies or interests to steer him toward another social activity. Okay. And Forrest, thanks so much for your patience. I just wanted to acknowledge what was also in the chat. What are your thoughts? What's your reaction?
I mean, well, first off, I would want to thank him for being transparent and being honest with me about what he's going through. Probably affirmed to him how much courage it would take for him to be able to come and talk to me about something like this, because of the fact that, well, I don't know you very well, but not knowing somebody and you actually sitting down with me and letting me know these things, I appreciate you for letting me know and talking to me about what's going on in your life. Then I probably would have asked him, well, with everything that you've already spoken to me about, how does this make you feel?
Okay. Okay. You know, Forrest, if it's okay, can I comment on something that you said?
Mm-hmm.
So I've been sharing this particular client scenario maybe 8 or 7 years. And this is the first time that I recall, as vividly as I'm recalling right now, that someone, you, Forrest, is suggesting starting their response to the client with an affirmation of the person's strength. So I really want to underline that, because remember, there's no one right way to proceed. And I want to underline that Forrest has offered a very specific approach, which is to start by affirming the client's courage for talking about the change that they're considering. So I just want to underline that, because in the 7 to 8 years, yes, a strengths-based focus, Jen, absolutely. And again, I just want to underline, in the 7 to 8 years that I have used this particular scenario, it gets a lot of mileage. Forrest, you are the first person who has ever started their utterance with an affirmation of the person's strength. Now, before we go, and again, that's one approach. There are many. But I want to ask a question of the learning community inspired by Forrest. And the question to the learning community is, what do you imagine could be the impact of starting with a strengths-based affirmation? What do you imagine could be the impact? And let's hear from 4 people, unmuted. And again, you're more than welcome to put what you want in the chat, but let's hear from 4 people unmuted. What do you imagine could be the impact of starting the worker starting their, yeah, and Val just put 1 in the chat, which is trust.
And I believe that starting with the affirmation, the client will look like, wow, they see my strengths. I can really do this. It's giving them encouragement. It's building a good rapport with your client. It's building trust. It's really letting the client be able to open up instead of being closed in, because they're saying, wow, this person is seeing what I am capable of doing more than myself.
Yes. Alyssa, is it Alyssa or Elisa?
Elisa.
Elisa, thank you. Elisa, I want to underline that you used a word a couple of times, which I think is really powerful, which is, it's the worker seeing. And remember, folks, seeing is offering a reflection. So an affirmation is a kind of reflection. It's coded as an affirmation because it's identifying a strength. But it is, to Elisa's point, it is a kind of reflection. And you know something? Clients want to be seen and they want to be heard. And that has a positive effect. So setting a foundation for mutual respect, the validating all these things you're putting in the chat, acceptance, non-judge, giving the client power in the change process. It nurtures the heart and makes them feel safe and inspired to want to keep going. All of this, and keep in mind, folks, that's through one intentional choice. Go ahead, Forrest.
And the only reason I do that is because I want somebody to talk to me that way. So if I'm gonna talk to me, if I want somebody to talk to me like that, then I need to talk to them that way.
Yep. You're modeling offering respect and that high vibration, MI-spirited energy. Go ahead, Jonathan.
I was just going to say, it also sounds like he's getting, warranted or not, he's getting a lot of criticism from his boss, his girlfriend, who knows where else. So just having a bit of, positive feedback, bit of affirmation is probably just a bit of a relief.
Yeah, absolutely. And Jonathan, if it's okay, can I ask you a quick follow-up question?
Yeah.
Would it be fair to say that the young gentleman might even think that me as the worker, that I'm maybe going to give him a hard time too?
Yeah, you probably come in with that expectation. Yeah.
Yeah. So if Forrest offers an affirmation of strength, wow, back to what Elisa said. Wow. it changes the relationship. It builds a positive relationship, a trusting relationship. It's the offering of respect.
And I think in my experience in crisis work, sometimes undermining a client's expectations of how you're going to react can sort of make them lock in more, like they're suddenly they're paying attention in a way they might not have been before.
Truly, truly. Which again, would it be fair to say that we could call that enhanced engagement or present engagement?
Yeah.
Okay. Okay. And Carol, I don't know if anybody saw this, but Carol also noted in the chat that noting strengths as opposed to weaknesses helps build confidence. And let's consider this, folks, and I'm going to invite you to think about this from your own perspective. It's probably pretty hard to move toward change if you don't feel some degree of confidence. And to know that your strengths are seen, Elisa, thank you for adding that. To know your strengths are seen and that somebody is reflecting them back to you using an affirmation is a powerful way to help build confidence. It's a real way to build confidence. One additional word about affirmations, because remember, they're part of OARS, OARS. Affirmations need to be authentic and specific. You can't just make something up because you think it's going to make them feel good. So Forrest authentically, based on what the client said, because he was actively listening, was able to identify a strength because it was an empathic understanding. He was able to identify a strength and affirm the courage to communicate that. We're going to come back to this example, folks, okay? And you know, this is the beauty of the learning community. Because of what you all offered, because of what Forrest offered specifically about use of an affirmation, that's one way. There are many other strategies that we could employ if the worker was going to open their mouth and say something next. Tammy writes in the chat, I always ask at the end of one-on-one, can I do anything for you to help support the client? Yeah. And Tammy, it's interesting because there's something in particular I want to underline in regard to what you wrote, if that would be okay. Can I underline something specific that you wrote? And you can type in the chat or you can unmute if that's okay. Okay. Tammy typed a Y in the chat. That means yes, I'm going to interpret. Can I do anything that may help or support the client? One of the unique things about the practice of motivational interviewing is that it's about the client mobilizing their own motivation and their own resources in order to go forward. It's much less about what I, as the worker, can do. And that's a little bit of a shift, because would it be fair to say, if you agree with this statement, and let me make this statement first, if you agree with this statement, type an A in the chat. If you disagree with the statement or think it's an overstatement, type a D in the chat. Would it be fair to say that most of us do this work because we want to help? If you agree with that statement, type an A in the chat. Okay, and if you disagree, it's perfectly okay to disagree. If you disagree or you're unsure, that's fine. Because remember, everybody's voice and everybody's reaction and opinion is welcome. The thing I want to underline in regard to that, and we'll get to this later, but one thing I want to underline in terms of that is that the practice of MI is engaging in an intentional conversation where the person talks themselves into change, where they activate their own resources to move toward the change. We're only guiding the conversation. We're not the motor driving the change. They have their own motor or motors. And I will go back. Craig writes in the chat, it's kind of like the premise of life coaching. Yeah, Craig, I think that yes, the client is accountable. And I'll add another A to that, Craig, which is that the client is autonomous. We're working in a collaborative partnership, but they're exercising their autonomy. And that's a good link to sort of life coaching. Yeah. Yeah. Celeste, do you want to?
Yeah, I just had a thought, because when I first started this job, there was, a heavy emphasis on the ors, and of course, like, this is all the MI spirit and all of that. And I never understood, like, there's always an emphasis that you are to be always curious, right? Even as the client is talking, like the scenario that you gave, I thought to myself, if I was sitting there and listening, my response would have been, well, tell me more. I'm curious, tell me more. And I learned that there's something powerful about hearing yourself talk. As the person is continuing to share more and more of their possible reasons as to why they want to change, it's reinforcing that, in their minds. And like I'm sorry if I'm sort of like not clear, but that idea of finding it within themselves to find the reasons for change. It's within them that they already hold that motivation. It's helping them to reflect more on it and increasing their motivation.
Yep.
So yeah.
Yeah. And again, Celeste, you're saying several things, and I want to underline them. One, you're saying that curiosity, being curious about this person's motivations, their desire to cut down the amount of weed they smoke on a daily basis, their ability to cut down the amount of weed they're smoking on a daily basis, their reasons for cutting down the amount of weed that they're smoking, and their need to cut down the amount of weed they're smoking on a daily basis. You notice how I kept bringing desire, ability, reasons, and need back to the behavioral change goal that they're considering. It's those things and being curious about those things that will strengthen this person's motivations to want to make this change. Their desire, their ability, their reasons, or their need. By the way, that spells darn, D-A-R-N, and that's a great way to remember it. So the more we hear from them, the more client speech that invites them to say more about their desire to cut down the amount of weed they're smoking, their ability to do that, their reasons for doing that, and their need for doing that, the more likely they are to make a commitment to cutting down the amount of weed that they're smoking on a daily basis. It's really not until part 3, but since this group is this group and we are where we are, when the person talks about their desire to make the change, their ability, their reasons, or their need to make a specific change, that's called change talk. That is the client's speech that we are listening for. Craig, back to your active listening, that we are actively listening for the change talk. Now, somebody earlier, like miles ago in the chat, pointed out the change talk in what the client said. Can anybody recall? I told you what the client said. I gave you the client's speech. What was the change talk? Can anybody recall what the change talk was from what the client said? And you're more than welcome to unmute. Yeah, people, yes, people do. Yeah, and Emma types it in the chat, and Emma, it might have been you who pointed it out the first time. His relationship and his future employment. That's the change talk. If there's a second thing that everybody in our learning community walks away with today, I want you to walk away with this. And it's building on what Craig said earlier. We want to actively listen for change talk. We want to be able to discern it in client speech. And when we are practicing motivational interviewing, we want to employ the change talk. We want to put it to work. And Celeste gave us a great example through curiosity about doing that. Because another approach after the client's speech that we had could be, you're considering cutting down the amount of weed that you're smoking on a daily basis. Tell me more about what makes you want to do that. That is an open-ended question that intentionally evokes more change talk. More change talk is good. More change talk is good. More change talk is good. Just so you know.
They hear themselves talking.
And
they hear themselves over and over.
Well, that is true. And that would then speak to the next level of employment of the change talk. Because let's say we go with Celeste's strategy and we ask that open-ended question and we get more. Yeah, thank you, Marigold. Marigold wrote in the chat, more change talk is good. That worked. Okay, very good. So it is. I agree with you, Marigold. I agree with you 100%. So let's say we go with Celeste's strategy, we ask an open-ended question, and we get more change talk. So strategy number one, we've evoked more change talk through the intentional use of an open-ended question. And notice the technicalness of that. I can technically decide that and then execute it and then get the result of it. So the first strategy we had on the table, and we had others even before this, but one of the strategies we had on the table was what Forrest suggested of offering an affirmation. We could have offered that affirmation and see what happened. And that would determine what we did next. Another specific strategy we had on the table was Celeste suggested an open-ended question that could potentially evoke more change talk. We get more change talk. Further employment, folks, is when you have change talk, do something with it. And I'd like everybody to point to your ears right now, if you're able to. If you're driving, don't take your hands off the wheel, but point to your ears. Your ears can remind you of what to do. You can stop pointing to your ears. Thank you. Can remind you of what you can do with change talk. You can invite elaboration. That's what Celeste's open-ended question did. You can affirm it. That is what Forrest did. He affirmed the strength associated with the change talk. You can reflect it. And I'm thinking of Elisa when I say this. Or you can put all the change talk together in a summary, which Miller and Rolnick call a bouquet. And you can hand that back to the person. And that is what we mean by employing change talk. Ears, elaboration, affirmation, reflection, or summary. Very similar to oars, but ears specifically around change talk. Deborah, thank you for the information. All right. Deborah just sent me a private message. That's great. Thanks for letting me know, Deborah. So keeping that in mind, folks. And at this moment, and we had other strategies, but at this moment, we are simply looking at two concrete strategies of practicing motivational interviewing while at the same time bringing that high vibration, energy, MI spirit, MI consistent approach to our engagement with the person. Okay? We are deep at this moment into the practice of motivational interviewing and the use of an MI consistent approach, MI spirit. Okay? Forrest writes, I have noticed that at times I will have to ask closed-ended questions because I can get an open-ended question. Is this something that happens? Yes, Forrest. And I appreciate you doing that because closed-ended questions are another tool. And keep in mind, folks, open-ended questions are a tool. They have a particular purpose. They create a particular response. Closed-ended questions are also an effective tool. I have asked a particular closed-ended question a number of times already. I'll give the example. Is it okay if I ask you a question? That's a closed question. Asking permission is a closed question. And I hope that you noticed when I asked and employed that closed-ended question, I waited for the answer. I have listened to so many audio recordings where people have said, can I ask you a question? And they don't let the person answer and they charge ahead with their question. So if you're going to use a closed-ended question where you're going to get a yes or no answer, please let the person answer the question because it will inform how you proceed. So yes, Forrest, closed-ended questions sometimes are. The other thing that I will just identify because you're asking about questions, and when I was giving the example that Celeste was talking about coding, I want you to consider, and I'm going to make an I statement here, okay? Because that's our guideline. I am a social worker. I can lower my electronic hand. I was trained to ask questions. Motivational interviewing emphasizes reflections over questions. We use questions. We use them intentionally. We hopefully use them to express curiosity, to evoke more change talk. The practice of motivational interviewing invites us to consider using twice as many reflections to questions. And let me just give you a mathematical computation. If in a conversation you ask 5 open-ended questions, hopefully you've offered a minimum of 10 reflections. Now that's a guideline. And the coding instruments are looking for that 2-to-1 ratio. And again, think about the purpose of that. The purpose of that is a reflection can build rapport, it can increase understanding, and to Alyssa and Celeste's point, it helps the person to hear themselves. And what we want them to hear is their change talk. They say it once, we reflect it back to them, and then maybe we include it in a summary. They've heard their change talk 3 times. That's how it gets strengthened and increased. The practice of MI is partly technical, folks. One other thing that I've heard many times in audio recordings, in addition to, can I ask you a question? No pause. Here's the question. No answer. Here's the question. Another thing that I've heard is change talk. The person speaking about their desire to make the change, their ability to make the change, their reasons to make the change, their need to make the change. Change talk is naturally offered or it's evoked, and the worker ignores it. They don't employ it. They don't ears it. They don't invite elaboration. They don't affirm it. They don't reflect it, or they don't summarize it. Ignored change talk is a loss of opportunity to increase motivation. I'm going to repeat that. Ignored change talk is a lost opportunity to increase motivation. Jonathan, do you have a thought or a question about that? Reaction? Can't hear you, Jonathan.
I was just listening to what you're saying, just leaning in.
All right. Just wanted to ask. Don't leave money on the table. If change talk naturally occurs, employ it. If you evoke it, employ it. Strengthen the motivation. Okay? We have moved deeply into the practice of motivational interviewing simply because, if you think about it, simply because we had the client speech that I shared with you, the client who's considering cutting down the amount of weed. You've already identified the change talk. You've already put strategies on the table about how to employ that change talk. Those were two. There's more. And whatever strategy you choose is informed by the moment, by your being present in the moment with that person. Okay? Now I'm going to pause before I show you the next slide. I'm going to pause for a moment, and I'm just going to ask, are there any comments, questions, or reactions at this particular point about anything that we've talked about at this particular point? Anything that anybody wants to say, react to, question at this particular juncture in our conversation? I know we have a lot on the table, and I just want to give you an opportunity to reflect on that, comment on that, question that at this particular moment. Nikki writes in the chat, are we supposed to be able to see the slides? When I show them, yes, and I haven't shown any in about the last 20 minutes. So yes, Nikki, there are slides, and I will share them with you in a moment. Some of what I've been talking about, some of the practicing that we've been doing is reflected on some of the slides. A great deal of it is not. Marigold writes, what if you have a client not engaging in any change talk? Do you not use am I then? Fascinating question, Marigold. Because keep in mind that change talk is always about an identified behavioral change goal. And I will underline that you cannot practice, these are my quote fingers again, you cannot practice motivational interviewing unless there's an identified behavioral change goal. You can use an MI consistent approach, high vibration energy, an MI spirit in any and every conversation that you have. You can practice MI when there's an identified behavioral change goal with another condition that is necessary for the practice of motivational interviewing. So there needs to be an identified behavioral change goal in order to practice MI. And then there needs to be another condition present in order to actually practice MI. And that condition is contained within the client speech that I offered you. Does anybody know what condition I am referring to? So in order to practice MI, there needs to be an identified behavioral change goal and another condition. Does anybody, and the clue that I just gave you is that condition is present in the client speech that I gave you. It's not substance use, because MI, the practice of MI can be used with any behavior change, not just substance use. It's been studied a heck of a lot in substance use, but it really can be with any behavior change. Darn is the quality, the desirability, reasons, and need about the change talk, but there's another condition that has to be present in order to practice motivational interviewing. Willingness to change, goals to achieve. I'll give you one more hint. Remember, it's contained within the speech that the client offered. The hint that I'm giving you is it starts with yes, the change talk is part of it, Marigold. That's partly true, but change talk is only one side of this condition. There's another side of the condition too. And the condition begins with the letter A. A behavioral change goal with this additional condition. Solana, acceptance begins with an A. That is not the condition. Affirmation begins with an A. That is not the condition. Action begins with an A. That is not the condition, John. Application, oh man, all of those begin with A, but they are not the condition. The condition begins with the letter A. I'll give you the second letter. I know, Samantha's like, what is he talking about? It's not W, John. The second letter, I don't know why I can't think of it. Yes. Well, I'm not surprised that you can't think of it at all. Aware. No, Brenda, aware does begin with an A. That is not the condition. Here is the second letter of the condition. First letter is A. Second letter is M. A, M, and a few other letters.
Is it ambivalence?
Who said that?
Me, Jonathan.
And is that Jonathan?
Yeah.
Jonathan, turn your question into a statement.
Ambivalence.
Yes. There needs to be, Jonathan is absolutely correct. There needs to be ambivalence about the behavior change. Jonathan, can I ask you a follow-up question? And Forrest, we're going to come to stages of change in just a minute. Jonathan, can I ask you a follow-up question?
Yeah.
And I'm asking you this specifically. If you, in your own words, were going to define ambivalence, what does it mean?
The first thing that comes to mind is kind of like wishy-washy, like not like uncommitted, maybe like unsure of
Yep,
the
Forrest just
direction.
wrote that in the chat. Yeah, he
Oh,
read
yeah.
your mind. Yeah.
But
Yeah.
yeah, just not knowing which direction to go in next.
Yep. Yep. Wishy-washy, unconfirmed, unsure, discrepancies. Yep. Does anybody else, how else would anybody else define ambivalence? Halfway in the door, halfway out the door, Mindy. I love that, Mindy. I've never seen the door metaphor. I love that. Yeah, John, you're right. It could also be a feeling of indifference to both sides. Also, Solana, the person may not care. Pre-contemplation. Well, actually, ambivalence indicates contemplation. Forrest, it could be a person saying, I don't know. That could be part of the speech too. Because remember, I said change talk is one side of the client speech. The other side is what's called sustain talk. It's what they say that maintains the status quo. Mixed feelings, Edgar says. Hem and haw. Him and haw or hem and haw. Yes. Hesitant to commit, John. Absolutely. Those are all elements of ambivalence. So in order to practice MI, folks, there needs to be an identified behavioral change goal that the person has that they feel ambivalent about. Part of them is considering the change. They have change talk that they've offered. We know our young gentleman has change talk. He doesn't want to lose his job. He's concerned about his relationship. That's the change talk. The other side of his speech was the sustain talk. Does anybody remember what he said that was the sustain talk? Brian, I'll look forward to seeing you next time. That's great. Yeah, go ahead, Samantha.
Was it that like he felt comfortable in his own skin doing it and it was a social activity?
Bingo. That's the sustain talk. That is the sustain talk. That is the sustain talk that he offered, and that is the change talk that he offered. That is the language of ambivalence. And go ahead, Craig. Go ahead.
I was just going to say, I think he actually came out and said, I don't want to stop, doing it. But then he came out after with the change talk. So,
yeah. He doesn't want to stop completely. He's considering cutting down. And he offered change talk and sustain talk. I want to share another image with you. Okay. It's related to change talk and sustain talk. And I'm thinking of Celeste as I say this. And I have to give credit where credit is due. My colleague, Kate Speck, who's also a member of Mint and an MI trainer and a friend and colleague, she uses this phrase a lot. And I think she stole it from Bill Miller, the creator of MI, which is, you get the dog you feed. And remember, folks, we want to feed the change talk dog, not the sustain talk dog. So if we reflect back to the person, and again, strategy, reflection, if we reflect back to the young gentleman, weed helps you to feel comfortable in your own skin. We just reflected the sustain talk. We just fed the sustain talk dog, which means we're going to get more sustain talk. Sustain talk does not guide toward the considered behavior change. The considered behavior change is to cut down the amount of weed. So just keep that in mind. Sustain talk is not bad. It is not negative. It is not evil or demonic. It is simply the other side of ambivalence. I'm going to ask everybody to type the following word into the chat. Opportunity. Opportunity. If you don't want to type out the full word, and that's okay, if you don't want to type out the full word, please type out OPP or OP. Opportunity. The presence of ambivalence about a behavioral change goal is an opportunity to practice motivational interviewing. If the person has a behavioral change goal and they don't have any ambivalence, they just want to make the change, do not practice MI. Go to collaborative planning and help them to make a plan. If there's no identified behavioral change goal, do not practice MI. Simply engage in a high vibration, MI spirited, MI energy informed, MI consistent conversation with the person. A behavioral change goal that the person feels ambivalent might emerge. You can only practice MI in the presence of an identified behavioral change goal, cutting down the amount of weed that I'm smoking on a daily basis, and ambivalence about that. Ambivalence about the behavioral change goal equals what? And type it into the chat. Ambivalence about I'll give you a hint. It begins with O. Ambivalence about and go ahead and type it again in the chat or the abbreviation. Ambivalence about a particular behavioral change goal creates the opportunity to practice motivational interviewing. The technical, directional, intentional, structured practice of motivational interviewing. Okay?
Paul,
Celeste.
I was gonna say that when we miss an opportunity, we would actually score we'd score like a 0 on it. So yes, it's like you have to train your ears for those things to listen to.
Yep, it's exactly what Craig said. It's that active listening. Active listening alone is not motivational interviewing. It's a skill, just like an open-ended question, an affirmation, a reflection, or a summary. It's a skill we use to train our ear to recognize the opportunity, to recognize the ambivalence. I want to underline something. Ambivalence is normal. There's a slide in the slide deck that says that. Ambivalence is normal. Ambivalence is common. It's part of the human experience. It is not the same thing as resistance. And in the practice of motivational interviewing, it's part of the behavior change, process. Okay? Now, I want to touch on something that Forrest put in the chat twice, because I don't want Forrest to think I'm ignoring him. I want to touch on what Forrest put in the chat about the trans-theoretical model or the stages of change model by Prochaska and DiClemente. It is not motivational interviewing. If you like articles and if reading articles is helpful to you, Bill Miller and Stephen Rolnick wrote a great article called The 10 Things MI is Not. And the stages of change model is one of the 10 things MI is not. The trans-theoretical model is a great way to understand the overall process of change. The practice of motivational interviewing is a method of communication about a change that somebody is considering. Yeah, and Val says, difficult for me to listen only and then not offer fix-it suggestions to consider. Yeah, Val, you're not, I bet you're, actually, Val, let me put it this way, and this is what's called an amplified reflection. Val, you're the only person in the learning community that feels the desire to fix. That's called an amplified reflection, because what I can say making an I statement is I also feel the fixing reflex. So just keeping that in mind. Yeah, and Marigold, you are making a very important point that the practice of motivational interviewing can be used with any behavior change, not just substances. Can be any behavioral change that somebody wants to make. Yeah. So in the last 15 minutes, believe it or not, we're at the last 15 minutes of our time together. In the last 15 minutes of our time together, I'd like to share a little video with you that we will, I'm going to ask for your reactions to, but I'd like to share this little video with you, and it will be the beginning of our conversation with part 2. But I'd like to show it with you and get a couple of reactions to it. And yes, Tammy says, say it isn't so. Yes, Tammy, it is so. We are at our last 15 minutes. Sorry. So here's the video. Just watch it. Have whatever human reaction you have to it. I'm showing it to you intentionally. It's not an accident. And then we'll discuss it, and it will be our gateway to part 2 next time. So here it comes. I hope that the Zoom platform is going to support me in sharing this video with you right now.
Smoking.
Okay, so finish the exam. Have some good news and I have some not so good news. Looks like you don't have any cavities, so that's the good news.
That's great.
However, I'm pretty concerned about something I'm noticing in your mouth. Actually, if you look up here, the roof of your mouth, I'm noticing a lot of irritation that's really consistent with tobacco use. And you had said on your form that you're not a tobacco user, so I'm just wondering what's going on.
I don't smoke cigarettes.
Okay. Well, as I said, there's a lot of irritation. In particular, like I was mentioning, up here in the roof of your mouth, it's turned really deathly white colored, and there's little red spots. And you probably didn't notice because we don't spend a lot of time looking at the roof of our mouth. But you're really damaging this tissue in your mouth, which can really cause some severe problems in terms of your oral health. It's called nicotinic stomatitis, and this is something we don't see in any patients who don't use tobacco. So maybe you're not smoking cigarettes. Are you smoking a pipe or cigars, or is there something else that could be contributing to this? Because I don't know what else might be causing it.
Well, the only thing, I've never smoked cigarettes ever. But when I go out with my friends, we like to go to, we like to go out to lounges and sometimes there are those nice young men that gift you different sorts of things. And we got some of those mini cigars, that Swisher Sweets. They come in peach and grape. And that's the only time that really, I've ever really used anything that's got tobacco in it.
Okay. So I think that's a pretty common misconception because they're fruit flavored. People think they're okay. Those are really bad for you. Did you know that?
Really bad, but they're just cute little girly cigars.
Right. They're still cigars and they're still tobacco. And so they still cause lung cancer, oral cancer, emphysema, all those same kinds of things that you would see with cigarettes.
Well, I only
really
use them just to relax. I mean, it's not like it's something that I would smoke 20 or 30 cigarettes a day. I mean, I only do it when we go out.
Well, at least you're not doing that. So that's good. But it's still causing a lot of problems. And as I said, I can see the evidence in the roof of your mouth. You're causing some serious damage, and this needs to stop. Have you thought about quitting?
Well, I didn't really know I'd started.
What do you mean?
I didn't really think that it was anything more than just like social drinking. Just something that I do in a social setting when me and my friends go out to the bars.
So you're going to quit then?
Maybe.
What do you mean maybe? I just told you how bad it is for you. It's messing up your mouth. You're putting yourself at risk for all these other diseases. This is really important. You need to quit. Well, it's something that I'll have to think about. What's there to think about? You said it's not that something you do all that often. There's all these negative side effects. There's all these risks that you're putting yourself in. Well, it's just something that I do to relax, and I don't do it that often. And so I probably could cut back. Okay, well, that's a good start, but cutting back isn't going to do it. If you actually quit the smoking, you can reverse all the damage you've done in your mouth, and you can stop yourself from being at risk for these other diseases. But as long as you're continuing to use these cigars, you're really putting yourself in a lot of danger. Well, I don't believe that they're cigars. And what I do believe is that it's a choice, and it's my right, and it's something that I choose to do. And so I will think about cutting back, but I'm not at a point where I'm ready to do that. And I'm not really sure that I even believe that what you're telling me is real. You're choosing to really damage your mouth, and actually it can cause problems with your teeth too. I don't know if you notice your teeth might be getting yellower than they were before. That's another side effect. There are a lot of really negative things that go along with any tobacco use, whether it's cigarettes, cigars, dip, chew, snuff, snooze, hookah, any of it. This is a really important decision that you're making, and you said it's your choice, but you're really choosing to make yourself sick and potentially die. Well, it's something that I'll think about. Well, I appreciate you thinking about it. I hope you'll think about it really hard. You know, this is something that I'm going to continue to ask you about because it's something that really needs to change.
Thank you for watching that video. So, Nikki writes, man, my dentist this morning was much happier about my lack of cavities, and I'll keep going back there. Understood. So, let me ask you to frame for yourself, what's one thought or reaction you have after having seen that video? And let's hear from 4 people unmuted, but anybody certainly put whatever you want in the chat. But if we can, let's hear from 4 people unmuted. What's one thought or one reaction that you Forrest writes, she's not a mint, so she wouldn't know what to say.
I thought she was unempathetic, and she was more like demanding instead of being a little bit more professional. Because she did not even offer any alternatives. You know, I just thought that her approach was wrong because the lady got on the defensive immediately, and she said, I'm not a smoker. So she could have, you know, talked to her in a different manner to me.
Okay. Elisa, thanks for starting us off. Yeah, go ahead, Samantha.
I think you said earlier it's about like guiding the patient to kind of getting to that point, which with her, she more was just like, this is bad. Like there was no guiding the patient to that. The patient didn't think that. And she was just kind of telling her like, no, this is bad. There was no like getting there together.
Okay. Okay. 2 other people.
There was no spirit.
Yeah, go ahead,
There was
Salon.
no
Yeah.
spirit. There was no spirit of motivational interviewing. That spirit was gone. She was not even close to feeling like, oh my God, she's really listening to me, because she acted like what she was saying was like, you gotta be smoking. You're lying to me. That's how she was communicating with her, like implying that you're a liar. And so she decided, really? So I'm not going to communicate with you anymore. I'm gonna tell you what I do, but it ain't smoking. I never considered myself to be smoking. So, you know, you impose your thought process and what you thought about what she was doing in a negative light. You wasn't motivational. Your spirit was accusatory. Nobody likes to be accused of something they feel like they're not doing, even though they may be doing it. right? Because she identifies smoking with cigarettes, not necessarily the little cute cigars that she's getting at, the gambling spot. But yeah, she was the spirit of motivational interview. She didn't sound like she wanted to help her. Even the tone of her voice was like, so even if she sounded more open to hearing what she had to say, we might have kind of got away with some of that stuff. But the reality is she was aggressive, and she was accusatory. And yeah, I wouldn't go back to her if it was
Okay.
me.
Okay. All right. Thank you, Salon. Tammy, what do you think?
She did not give her, bring it to her in a way that gave her the opportunity to change or work on it.
Mhm. Yeah. Agreed. Agreed. So let me make something very clear, because I'd hate everybody to leave part one and think Paul showed us the weirdest video at the end that was motivational interviewing. That video was not, am I consistent? Salon, you're absolutely right. Was not, am I consistent? Was not, am I spirited? Was not high vibration energy, nor was it, am I approach or consistent? So it was an example of what would be identified as, am I incongruent or am I inconsistent approach? It is also what could be labeled as a directive, worker centered approach. Okay. Now, Elisa, you identified something really critical to consider. And I love the way you put it. And I want to make sure that I heard you correctly. You said the patient got on the defensive. The patient didn't start defensive. The patient only became defensive when she needed to defend herself. The beauty of this video, and the reason that I show it to you, is because A, it is the absolute contrast to an MI consistent approach, MI spirit. It also is a perfect example of how the worker's desire to fix, educate, and rescue the patient can actually create, evoke, sustain talk and resistance. This woman didn't start resistant. She was attacked into resistance. And we're going to talk more about this when we come back in part two. So don't let this video fade out of your memory. We're going to come back to it for part two. Who didn't see she needed to, who didn't see she needed to be rescued? She didn't, stood her ground, feeling the need to defend herself. Yes, and you're absolutely right, Salon. And she was forced into the position of like, in fact, I happen to have the advantage of having seen this video about 738 times. And there is a line that I can quote where she says, the patient, the lady with the pearl, says, I don't even believe what you're telling me is real. I mean, if you're going to call me a liar, I'm going to tell you that I don't believe what you're telling me is real. And I love it because she then says, but what I do know is that it's my choice. Powerful. And how wonderful that this woman was able to hold her ground, because not every patient would say that. Some patients would just say, oh, yes, and they would have walked out the door and never come back and bought like a carton of cigarillos and smoked them up. So at least this patient said, I'm standing my ground. It's my choice. So just keeping that in mind. We are going to come back to this for part 2. What I'm simply going to ask in the last moment of our time together today is allow one word to come to you about your experience of our time in the learning community together today. One word that describes your experience in our learning community today. And just type that into the chat. Just one word. There's no right or wrong here. It's just whatever word comes to you, or words. I see some people are using 2 words. That's fine. Whatever works best for you. Whatever word comes to you. There's no right or wrong here. And once you've put that into the chat, please, if you can, read what other people are putting in the chat. I'm very much looking forward to seeing you for part 2. Welcome back. Thank you so much for being here. Couple of basic reminders. Our learning community guidelines remain the same. And of course, let me just reiterate, we want to be intentional about using language that is welcoming, respectful, and inclusive of everybody in our learning community. Because this is a learning community, what we talk about, what we focus on, will be relevant to our needs and our exploration of the evidence-based practice of motivational interviewing, and it may not necessarily reflect the official views of our funder. And that's okay, because it's meant to benefit you. The other basic things is, remember the keeping your camera on and active. And if you need to step away, just send me a private message, BRB, be right back, and then just come back and join us. That's fine. And again, stepping away is for a moment or 2. It's not for, 15, 30 minutes. That's stepping out. And just also the reminder that, of course, in order to receive credit, you must attend all 3 parts, all 6 hours. And again, final one is, if you wouldn't mind remaining muted unless there's something in particular you want to say. And when there is something particular or something you want to share, reflect on, comment on, have a reaction to, don't hesitate to unmute, don't hesitate to interrupt me. What I would ask, though, is if Vincent has the floor and Vincent is making his point, that nobody interrupt when one of the other people in the learning community, other than me, is making their point. We'll let them finish their point, and then if you want to comment, you can. And the final guideline, just as a reminder, that if everybody would please be willing to speak from the I believe this, I know this, I learned this, I have this experience. Can everybody agree to those guidelines as stated? You can wave, nod, throw money, give a thumbs up. Excellent. Thank you, Eula. That was a double thumbs up. Fantastic. Thank Louisa. Excellent. Thank you, Jonathan. Fantastic. Fantastic. Okay. And follow Michelle's excellent example. Oh, and Jen just flew money. That was great. It was like $1 with wings. I love that. Thanks, Jen. That just flew right into my savings account. Also, just a reminder, if you do have anybody at your computer with you, you're sharing your screen with them, please do make sure that their names are typed into the chat too. And if you have not yet typed your full name into the chat and where you're from, please do that, because I want to have an official timestamp of that you are here, because you should get the credit that you deserve at the conclusion. Yes, I think I remember that you had mentioned that, about that there was going to be a limitation and that you didn't need the credit. So that's understood. All right. And thank you, Leslie. So I think I mentioned to some people that were here earlier that since I saw you last, I had the opportunity to travel to Albany, New York, and I'm working with 2 groups of people who are learning how to train motivational interviewing. And it's through the Office of Substance Abuse and Alcohol Services. I'm not exactly sure if that's exactly what their acronym stands for anymore, but it's the state entity. They have hired myself and our Addiction Technology Transfer Center to update their motivational interviewing curriculum and then to train a whole new group of trainers that will train MI throughout the state. And I had mentioned before we actually got started that I thought of this learning community several times during that training of trainers. And one of the reasons for that, folks, is that I wanted to offer you all an apology, which was this, that I know that in our first hour of the conversation, first 2 hours of the conversation, I didn't share a lot of the slides with you. We had kind of a dialogue about it, and we got the opportunity to do a little practice. You may remember the guy that I talked to you about, the guy who was considering cutting down the amount of weed that he was smoking on a daily basis. We identified his change talk. The reason that I wanted to make an apology to the learning community is that I know that some people are visual learners, and it can be helpful for them to look at a slide as a concept is being, and that kind of came up during our training of trainers, and it really brought me back to our conversation. So for those of you who it will help you to also see the slides. Now, the slides don't have, thanks for letting me know, Val. The slides don't have the specific scenarios that we're discussing, but they do reinforce many of the concepts. So I'm going to try and do a better job today balancing showing you the slides and also engaging in dialogue. Okay, Forrest says I'm forgiven. Thank you, Forrest. That makes one of us that you have one of you who has forgiven me. So thank you for that. So my Jonathan, I guess it's okay with the two. So again, I just want to I want to thank you for allowing me to just share that with you because again, I want to make sure that there's a good balance of that everybody, depending on their learning style, is feeling supported in what we're doing. So to that end, before we go back to the video for a moment, I'm going to share my screen and I want to share a couple of slides with you just to reinforce a couple of the concepts. Now, I will also repeat, and I know I told you this in the first part, that we're going to send you a copy of these slides. So having said that, I'm going to share my screen and I am going to share this first slide. Now, it's ironic, and if you can use the chat just to let me know that you can see this slide and you can see me at the same time. Now, and you can type the letter Y in the chat. That's how I'll know. Okay. Good. It looks like, okay, so some people can only see the slide. All right. Okay. All right. Well, thanks for letting me know that, Forrest. And again, everybody learns differently, so I truly want to respect that. And it's ironic, I'm showing you the slide, but the first thing I'm going to tell you is don't read it. Now, the reason for that is we had a pretty in-depth conversation about ambivalence. And oh, wonderful. Craig can see me now. Okay, good. Thanks, Craig. So we had a conversation about ambivalence, and this is a definition. You may recall you all offered your own definitions, which frankly I think are more effective than this particular definition. I'm going to advance, though, because I do want to reiterate that we keep in mind these couple of points. That first and foremost, ambivalence is common. It's a pretty common experience. It's also normal. Because somebody may be experiencing ambivalence, it doesn't mean that there's anything pathological or abnormal about that. It's also part of the human experience. And I think somebody in our learning community actually said that, you know, ambivalence is just part of being human, because we're often considering things that we may feel two or more ways about, or we may have strong feelings one moment and no feelings about it the next moment. It's also, and this is very relevant to the evidence-based practice of motivational interviewing, it's also relevant to the change process, meaning that if somebody is ambivalent about a change, if part of them wants to make the change and another part of them wants to keep doing what they're doing, like the young gentleman that we talked about, ambivalence is just, that's a normal part of that, looking at both sides of what their argument may be. And also very important to consider that when somebody is expressing their ambivalence, that is not the same thing as being resistant. Now, I want to ask a quick poll question, and you can use the chat feature. Would it be fair to say from the video that the lady with the pearls expressed resistance to the dentist? If you think the lady with the pearls expressed resistance to the dentist, type the letter Y in the chat. If you're unsure, type the letter U. If you think that she wasn't resistant, type an N in the chat. Yes, it's interesting. Craig says yes with good reason, and Forrest says no. Okay, and a number of other people are saying yes, and Emma says no. Okay, and Craig, I'm wondering, would you be willing to unmute and say what you mean by yes with good reason?
Because the dentist gave her every reason to resist. She was putting the patient in a defensive mode. Even at times, I feel she was insulting the patient. So yes, that's the good reason.
Okay, fantastic, fantastic. And Forrest, you had said that you didn't really think that she was expressing resistance. Could you say a little bit about that?
I mean, if I really look back and think about it, she basically told her many times, I am not a smoker. She told her
Yeah.
that this is what I'm doing, this is who I am, this is what's going on. So if you're pushing me into a corner and I'm looking at it from my point of view, I'm empathizing with her at this point. I'm gonna be resistant a little bit too, but I don't want to consider it because to me it's not resistance. I told you what it was. You just
Okay.
weren't listening.
Got it. Got it. Got it. And again, I'm going to stop sharing my screen for a moment because I want to underline it. And I'm going to use your words if you're okay with this. I told you what it was, and you're not listening. And I can appreciate the nuanced understanding that Forrest is suggesting, that, you know, that's not necessarily resistance. That's just expressing my truth, because that's not who I am. So I want to underline something in regard to MI's take on resistance, and it's very relevant to the video. And it touches back, it's kind of a blend of what Craig said and what Forrest just said. Because what can happen is that the worker, or in this case, the dentist's approach, can cause the person to do two very specific things. And you will understand what I mean by these two things based on what we talked about in the first part of our learning community conversation. One of the things is, and Val, we're going to get to stages of change in just a minute because there is kind of a link. MI looks at it from two perspectives. Perspective number one, the approach of the dentist caused the patient to offer more sustained talk, more why she was going to continue doing what she was doing, why what she was doing was not bad, what she was doing. And to Forrest's very insightful point, well, what I'm doing is I'm not a chain smoker. I'm not smoking, I'm not a smoker. I just occasionally enjoy a cigarillo. Okay, that's her conception. So the worker's approach caused her to offer more sustained talk. Okay, so we can say that evoked sustained talk. The other thing that is connected to this is that in MI, it's described as discord. And that means there's no harmony, there's no collaboration in their relationship. There's discord in their relationship. The style of the dentist evoked discord. And I want to link it to what Craig said, because Craig said she had to defend herself. And I love the way you put it, Craig, with good reason, because she was being attacked. Yeah, and Forrest is dancing with discord or roll with resistance. Actually, roll with resistance is out of the picture now because it doesn't appear in the 4th edition of their book, and that's because of dancing with discord. And the dance we do if we experience discord is, what are we possibly doing to evoke the discord? And we know what the dentist was doing. We know what the dentist did to evoke the discord. So that's kind of the take on resistance. The presence of more sustained talk, and then the falling apart, the lack of partnership in the collaboration. There's no more collaboration. It's now discord. The relationship is harmed. It's not irreparable, but it's harmed. Okay? Understood, John. No problem. All right. So, a couple of other things that I want to underline before I show the video again. Well, I'm not going to show the whole video again. There's a part of the video I want you to specifically look at, and I'm going to ask you to watch for something. And that is that I don't know if anybody recalls this, because I've had the benefit of seeing the video over 700 times probably. So I almost know it by heart. But I don't know if anybody recalls this. And if you do, feel free to unmute and say that you did. Forrest writes in the chat, even when the patient offered change talk. Forrest, you just read my mind, because this is what I was going to point out. There was a point when the woman said, I'll give this some thought, and maybe I could cut back. Does anybody remember that? Forrest, you remember it? Okay, does anybody, Eula remembers it? Okay. Does anybody else? Okay, so here's the second part of the question. Does anybody remember what the dentist said? Now remember, I have the benefit of having seen the video almost over 700 times. So does anybody remember what the dentist? Yeah, and Craig writes, almost like the dentist was forcing the patient. Yes, absolutely. She was attempting to force her to see it her way. And Solana, you're absolutely right. She offered a harm reduction goal. And what did the dentist say? And Forrest just put it in quotes. That's a great start, but you need to completely stop. And she did say, and I get it why you put it in quotes, Forrest, that's not good enough. She basically said something to the effect of, well, that's a good start, but that's not good enough. And actually, I think the direct quote is, that's not going to do it. So what message does that send? No hope. Yes. What? Yeah, go ahead, Craig. What do you think? What message does it send?
I was just going to say, it's either my way or no way. Your point as the patient doesn't matter. I'm smarter than you. That's the way I saw it.
And you know what? I bet the patient felt that way too, Craig. And I'm gonna even say it this way, and tell me if you think this is okay. But I think that the message that the dentist also communicated, it's my way or you're gonna die. You either quit 100% right now or you're gonna die. Yeah, I love it. She came in hot. She came in very hot. Yes. Okay. So I just wanted to underline that point too. And the reason I want to underline that point, folks, and this is the physical activity part of the training that I'm going to ask you to engage in. And I have to be honest and let you know this is not in the slides, but I'd really like you to walk away with this idea, which is there's such a thing as being able to course correct. And the reason that it's a physical activity part of it is because I'm going to ask you to do a gesture. I'm going to do it first, but then I'm going to ask you all to do it with me. And it's a way that you can remember how you can actually course correct. Because to your accurate memories, folks, the lady with the pearls offered the dentist an opportunity to course correct, and she threw it out the window. She totally ignored it and threw it out the window. In fact, she confronted her even more. Okay, so here's the gesture. Course correction, course correction. Let's all try it together. So you put your hands together, course correction. Let's all do it. All right, we'll try it one more time together. Course correction. Fantastic. I wish this was recorded. Oh, actually it is. So that's fantastic, folks. Thank you. And the thing I want to remind you of, some people get very caught up in the idea that I've got to do, am I right? I've got to get it perfect. Well, first of all, there's no such thing. There's no perfect and there's no one right way. And what I want you to know is that dentist, although she did not choose to, she could have course corrected and she could have changed their relationship. She could have decreased the amount of sustained talk that was coming, and she could have focused on engagement. And she didn't choose that. She chose my way or death. She chose, you need to follow my directions because I'm smarter than you. I'm the expert. See that diploma on the back wall? I'm a dentist. I'm telling you what to do. And what I want you to know, folks, is that's an am I inconsistent approach. Okay. It says that the provider isn't meeting the patient where she's at. It says that 100%, and that can create discord. You're absolutely right. And then this could cause more escalation instead of de-escalation, 100%. And that's exactly what we saw in the video. So before I bring us back to a particular point in the video for us to look at together, I just want to invite anybody. Is there anybody who'd like to unmute and say anything else about the video? Yeah, go ahead, Craig.
I don't even know if that's specifically in her field. Like she should have made like maybe a referral to a specialist that deals with that, because you're going to a dentist for your teeth, not to hear about smoking cessation.
Okay. Okay. Yep. So maybe she was so out of her lane that she didn't know how to approach it. Okay. Yeah. Any other thoughts or any other?
I have a question.
Yes, go right ahead. Go right ahead.
So I know like for obviously like therapists or counselors,
Yeah.
this is something that we would practice, but is it also like required of other professionals to practice motivational interviewing? Like would the dentists be aware of that?
Well, you're raising an extraordinarily important point, because first and foremost, you know, an organization, a program may say, hey, we want all our folks to be able to be effectively, use an MI consistent approach for every conversation that they have. And we want them to be able to practice motivational interviewing when there's an opportunity to do that. So a social service organization, a program may make that decision, and hopefully they would invest the resources and the time to let you all, go to trainings, record. And I'm thinking of Celeste from last time talking about having conversations recorded. So hopefully an organization would make that. Your point being that, like, hey, maybe dentists don't get this training, or maybe healthcare providers don't get this training. I think that's a very important point to consider, because maybe they don't. They are, though, involved in the idea of and in the process of behavior change. And if they really want to help people to change their behaviors, it's only to their benefit to learn, practice, receive feedback, and build their capacities. And your question is such a good one, because I don't know if anybody knows this. Some people may know this, but there's actually a companion video to this video. And it's the dentist in the same conversation actually using an MI consistent approach. So if time permits, I will show that today. And if time doesn't permit, I promise you I will show it on the third day. But we will see the third 2-hour session. But we will see the dentist actually adopt an MI consistent approach with how they engage with this very same patient. So a couple of things came into the chat. Is there anything else that anybody wants to say or wants to unmute and comment on, while I just quickly make sure that I am not missing? Yeah, it's potentially out of her pay grade. That's true, Forrest. And it is absolutely relevant. Solana writes, I do think the dentist should have mentioned smoking cessation. She actually did, but she said, you have to quit. Most medical professionals have a requirement to do so if indicated, yes, because we're getting more integrated care. I worked in a vitro how do you pronounce that, Solana?
Retinal. So the back of the eye.
So it's for eyes. You say
the
that
retina.
It's ophthalmology. Vitreoretinal. Okay, yes, because the vitreous humor is the fluid inside the eyeball itself. For 11 years, and was an important part of eye health conditions. She just went about it in the worst way. Yeah. And tell me if you would agree with this. And I love the way you concluded with that. She just went about it the worst way. I'm going to throw out that she probably went about it in the most common way. Would you accept that in her role, she sees herself as like, I'm the expert, I just tell you what to do, and then you jump this high? Is that fair? Yeah. And the thing I think to consider is, yes, she may not be aware of these particular kinds of approaches. And it's unfortunate because potentially, and you may or may not agree with this, and you can put in the chat like A for agree, D for disagree, U for unsure, but a possible outcome, and you tell me if you agree with this or not. Let me say it first, though. A possible outcome of this conversation is this woman doesn't go back to this dentist and she stops going to dentists. Is that a possible outcome? So if you agree, A, if you disagree, D, if you're unsure, U. Okay. So I'm going to note that it looks like, at least at this point, of the people that have responded, and I hope everybody will respond, but at this point of everybody who's responded, it looks like the high percentage is that loss to care is a possible outcome. And that's really unfortunate. And I bet the dentist would be mortified I could be wrong. She would be mortified if she thought that what she did drove this person out of care. Yeah, and Forrest is also adding, she could also word of mouth the agency as well. And John says, I disagree. She can choose a different dentist. Yeah, that's true, John. That is very true. She could potentially say, this dentist doesn't work for me, but I'm not giving up on my teeth. I'm still going to go to somebody else. That's also a possible outcome. But it's an outcome where the dentist has caused her to go away. All right. So I'm going to, Sasha writes, let me see what that says. It could lead her not seeking help in general. Yeah, she might have a very bad feeling. She could go to another dentist. She could just stop seeking help in general because, like, all medical professionals are like that dentist, possibly. Maybe not at that clinic. I think that it's more involved than I tell you to jump and you ask how high. I agree. And that, yeah, and it's interesting that you think it's lack of patient education, because I will throw out, and I'm open to a different perspective on this. I think that this dentist, at least in this video that we saw, she was really into, like, I'm going to educate this patient, and I'm going to educate her into doing what I want her to do. Does anybody have a thought or reaction to that? Did you see it that way? Did you experience it that way? That the dentist was very invested in sharing her knowledge, but sharing her knowledge with the express purpose of that I'm going to educate her into doing what I want her to do, which is I want her to quit right now. Would you agree with that? And you can disagree. You know, we're a learning community. We don't all have to agree on this. That's kind of my take.
I was gonna say that.
Go ahead.
I was gonna say her intent might have been good. Like, she wanted to probably scare her enough that she would want to stop versus making her feel hesitant.
Yeah. And could I ask you a quick follow-up question in regard to that?
Sure.
So if that was her intent, what do you think the outcome of her approach was?
I think what we probably didn't see was she could have had a change of how she interacted with her.
Who could have had a change, the patient or the dentist?
Both.
Both. Truly. Yeah. But I guess the thing I want to also underline, and maybe you'd be willing to say this, and then we'll go to Sasha as well, but would you agree that the dentist was invested in educating the patient?
Yes.
Okay. Yeah. And then I see a number of hands. Go ahead, Sasha, and then we'll go to Taryn. Yeah, go ahead.
I was gonna ask, going back to what you said where we were talking about like resistance, isn't that what, like, when we start labeling clients as like difficult or resistant, when we want them to do something that we want them to do and they don't want to do it?
I found that, yes, that a client becomes resistant when they're resisting my excellent advice or my caring or informed advice.
Right.
Yeah. Taryn, what were you going to say?
Well, I said that in the chat because I think, like, yes, the provider had an appropriate approach, but I think it could stem from frustration that patients don't want their oral health to be a priority as they feel so, because they've trained to be so.
Okay.
I think it could stem from that. That's why I said patient education, because if there was more like comprehensive, overall kind of adaptive patient education, it wouldn't have to get to that point where it's like, why do I want this more than you? Like, it's your mouth, your oral health, you know?
Yeah.
That's how I thought about it.
Yeah. And I guess, can I ask you a follow-up question?
Yep.
So I'm very intrigued with what you're saying, and I want to get a sense of, like, if you were in that moment with this patient, how would you go about helping her to maybe increase her investment in her own oral health?
As the provider?
Yeah, as the provider. Yeah.
Yeah, I would obviously approach it differently, more of like, okay, where are you at? Okay, you don't think this is dangerous to you. The fact of the matter is it is. Like that's a fact. But maybe more of like behavioral approaches, like here's the education, here's what you're doing. These things that you're smoking are a part of tobacco use that lead to this. Like that's a fact.
Yeah.
But maybe giving her the education of, what these things actually are. Like, does she know that they're tobacco? Like, it doesn't seem like she does. So it's just kind of like meeting her where she's at and, trying to make steps towards that. And I think that starts with educating on what she's actually doing to her oral health.
Okay. Fantastic. And before we go to Forrest, I just want to underline, I heard you when you said, well, I would approach it a different way. And the way that you just described what you described is already a 10,000 degree shift from the way the dentist approached it. If you spoke to the patient the way you just described that to me, I'm confident that there would be much more partnership and much less discord in the relationship. So I want to underline the strength that you're bringing even to your description, because it's a very different approach than the way the dentist, because I'm thinking of what Forrest wrote in the chat. She came in hot. She came in hot with a very hot perspective.
Well, and I was just looking at it from like a more overall perspective of like, how did the provider get to that point? Like, and maybe it's not, but it's just like a different view of like if there was more of like comprehensive patient education of like allowing themselves to advocate for them, so providers don't like have to feel that they have to want like health better for other people,
Yeah, 100%. And I also just want to say, before we go to Forrest and then to Craig, I also just want to say you are inching me so much closer to making sure that we watch this second video today, because I think what you're going to see in the second video, and I don't want to put a thought in your head. I want you to see it and make whatever determination you make for yourself. So I'm not going to say anything else, but I just want you to know you're inching me so much more closer to wanting to show that second video today based on what you just said, because you're really describing an effective path forward. And this first video that we saw, which we're going to look at a little bit again in a minute, was not an effective path forward. In fact, sadly, it could have been an ending. So excellent. Thank you so much. Thank you. Forrest, the floor is yours. Thanks for your patience.
Oh, no worries. Even just hearing this story is bringing back some of my own things that providers have done to me.
Okay.
Right? I've actually had a doctor tell me, I'm being transparent right now, that he wasn't going to prescribe me medication for my chronic illness because he didn't see it in my bloodstream. And I'm like, bro, what are you talking about? But even still, it's not your path, my dude. You can't pick and choose for me what you want me to do. I'm gonna pick and choose that. And so now I guess I'm seeing myself on the other side as the patient. And I can see and now I see where Taryn just said it too. As providers, we want the best for our patients. We the best for our clients. We may think that we know what's best for them, but in honesty, the patient knows what's best for them before we could even think of it. They know what's best.
Yeah, and to that point, and again, there may be things they don't know, and there may be information we can share with them, and that's part of the education possibly. But somebody put in the chat, and Craig, don't lose your thought, but somebody put in the chat that it was an example of serious fixing reflex, and we haven't even gotten to that yet, and we will. But fixing reflex, folks, is that driving desire to want to help, solve, rescue, and sometimes that seriously backfires.
Exactly. His fixing reflex actually made me leave the hospital. Like I reported him to patient relations and everything because of the way I was treated. You understand? Or the way that I
I
was
do.
spoken to.
I
And
do.
I wish that he had provided some of this right here. Because maybe I would have thought about it a little differently. You know, at that time,
Yes.
I would have thought about it differently. I would have took a step back. I would have looked at myself, did a
Yep.
little mirror work,
Yep.
and
Yep. Yep.
probably was like, okay, maybe he has a good point, but to just say, I'm not giving it to you anymore, that's causing more harm than it is good.
Yes. And harm on several levels, not just one, on like several levels. Yeah. Yeah. Craig, thanks for your patience. The floor is yours.
No problem. I just wanted to say, in terms of meeting the patient where they're at,
Yeah.
you can plainly see that after it was said like a couple of times about that specific whatever it was, that the roof of a mouth or whatever.
Yeah, nicotinic stomatitis, by the way.
Right. Sorry. Yeah.
Watch
I don't,
the video 700 times and you'll remember that.
right. You could tell even after the first time she brought it up, but more the second and the third time after the dentist brought it up, that the patient was not happy about it, wasn't engaging with it, and didn't see it as a problem. So at that point, you just do your duty to educate and then leave it there, because you're meeting them where they're at. So you can see that's where she's at, that she doesn't view it as a problem. You educated her on what can happen, and you can offer a referral, and that's it. Leave it there.
Okay.
She kept persisting on it, and that's what I think made that whole dynamic with that's what the patient was upset about. And if it was me, I would have walked out if somebody was talking to me like that.
Okay. Okay. And thanks for candidly commenting on that. And actually, Craig, you inspire me to want to take a quick poll of our learning community, because Craig just said, and tell me if I'm quoting you correctly. Craig just said, I would have walked out if somebody talked to me like that. So the poll that I want to quickly take, if you would have walked out or not come back ever to this dentist. Now, to John's point and to other people's point, you may have gone to a different dentist, if you have the resources to do it, because not everybody does. But let's just say you have the resources to go to a different dentist. My question, and I'm going to ask everybody to put this in the chat, to type in the chat. Would you have walked out or never gone back to this dentist? If you agree with that, type A. If you would have gone back, type okay, so far I'm seeing all A's. If you would have gone back, just type a W for would have gone back. Okay? Okay, excellent. So far I've seen 2 W's. And Jonathan, Sasha, and I think you put W as well. Anybody who put W, would you like to unmute and say a little bit about why you and Salon just put it, why do you think you would go back to this particular dentist? And Dawn writes, I would never return. Go ahead, Jonathan. What do you think? Yeah.
I just wouldn't want to have to go through the effort of finding a new one.
Understood.
Like, as long as she's cleaning my teeth, I can deal with her, having an attitude for a while.
Okay. Anybody else yeah, go ahead, please. Go ahead, Sasha.
Well, I would give her a second chance, because I mean, sometimes, like, at least for me, I have to make a change that I don't want to make, if that makes sense. Like,
yes,
obviously it's something that's good for my health, and I might not be ready, but it's something that I need to do. So I would sort of use that, even though her approach was not like strength based or positive.
Yep.
It's sort of a motivation.
Yep.
To change. But then I would see where the relationship goes from there. Like, if she's just always pushy, then I'm like, yeah, I might find a new dentist.
Okay. Okay. So you give her a second chance, but if she blew that, then it's like, I'm finding a new dentist.
Right.
Got it. Got it. Got it. Got it. Got it. And I don't know if anybody saw what Forrest just wrote in the chat, but I want to read it out loud because it really strikes me. And again, I believe, Forrest, you're speaking for yourself, and other people may agree with you. You get one opportunity to be disrespectful. Yeah. Yeah.
I just believe that people's intention is to help. And so I might have let her have it then, and she might not have wanted me to come back. But also I sit on the board of directors for the area health center that I go to. And I would have a conversation with the powers that be about her personality and temperament, and maybe we should not, I would take it from a different perspective, because I want to support the community health center that I go to. And we don't necessarily get a whole bunch of dentists who want to work in that particular community.
Yes.
And so I would offer the opportunity to the board to talk to training about the dentist department because of my experience. And so there are other people who would use that department and not come back, because that's just the community. And so, in the community, we got Seal a Smile, we got this, we got that. And so we want to make sure people are still transitioning that information to their kids. If we leave, then where do they go? You know what I mean? So that's my perspective. I would continue to go, but I would jack her up right in the middle of the meeting. Like, I'm not sure who you think you're talking to, but let's be more positive about these teeth that belong to me. So yeah, I would be a little bit more assertive in my response to her behavior. But yeah, I'd still go back. She probably wouldn't want me back, but I'd be back just to be back. But
well, I just want you to know, I want you back at every training that I ever do. So thank you. So I want to just observe, intent and impact are two different things. Truly, for us, they are. And I want to acknowledge that in our learning community of 37 people, I think I only saw 3 people who said that they would go back. Everybody else said they either would have walked out or not gone back, which prompts me to want to share a little statistic with everybody. And I think I read this statistic in the 3rd edition of Miller and Rolnick's book. And it really, and hopefully I'm remembering it correctly. So take that with a grain of salt. But they comment in the book that 20% of people are likely to do what you tell them. 20%. Now I'm going to ask you to do the math. I'm sorry, it's the morning, but I am going to ask you to do math. If 20% of the people out of 100%, if 20% of people will do what you tell them to do, what percentage of people does that leave that will not do? Yes. Thank you for doing math. 80%. And the question I invite all of us to consider as we are in this learning community is, can we afford to be ineffective with 80% of the people who sit across from us? I can't afford that. I can't afford that. I can't afford that on a personal level. I can't afford that on a professional level. Agreed, Eula. Nope. I just can't. Yeah, not at all. Yep. Agreed. All right. How did they figure that out? I'm not really sure. It's kind of fascinating. It really jumped out at me when I was reading the 3rd edition, and I didn't really look further. I just accepted, because it was in their book, that it was. But I love the fact that you're asking, like, how did they measure that? Because it raises a valid question. And I want to kind of link myself to what Craig said and also what Salon said, because if a provider spoke to me that way, I think I might strongly advocate for myself, and they may not want me back, possibly, or I might get up and walk out in the middle of it, and I probably would not go back at all. And that's just me. I'm just making an I statement here, because everybody's different and everybody has different circumstances that they're considering. And Forrest says, I've walked out for less. Well, Forrest, I'm glad you're still here in this learning community. You have not walked out yet. So I'm going to keep my fingers crossed that I'm hopefully doing something effective to keep you here. Fantastic. All right. So folks, I'm going to share my screen one more time. I just want to cover a couple of other things. And then I want us to look at a very particular section of the video. The first video, not the second one. I'm still hoping we're going to get to watch the second one together today. So I'm going to share my screen. We're going to just touch on a couple of other things. And then I want to show you that video. Now, you may recall in part one, I spent a considerable amount of time really emphasizing and focusing on drawing the distinction between an MI consistent approach and the practice of motivational interviewing. And what I want to share with you here, and I know you'll know this already, but because of what we talked about, but I want you to have a concrete, defined definition of what constitutes the practice of motivational interviewing. Now, first and foremost, we know that part of an MI consistent approach, MI spirit or an MI consistent approach, which is not the same thing as the practice of motivational interviewing, is that we're engaging in a client-centered conversation between two collaborating partners. We position ourselves as a collaborating partner. To make it the practice of motivational interviewing, there needs to be that behavioral change goal that the person feels ambivalent about. And remember, ambivalence is common. It's part of the change process. The young gentleman who was considering cutting down the amount of weed that he smoked on a daily basis, he was ambivalent. There were reasons he liked smoking weed on a daily basis and did smoke weed on a daily basis. And there were a couple of reasons that he was considering cutting down. Also, in the practice of motivational interviewing, you may remember, and we have our colleague to thank for the idea of structural. The practice of motivational interviewing is structural, it's intentional, and it's selective. We are guiding the conversation intentionally to explore the ambivalence about the behavior change, and especially to identify and increase that person's motivations to consider or make that change. And that's what we mean by evoking change talk and then employing or putting the change talk that naturally occurs or is intentionally evoked, putting that change talk to work. And you may remember that we had several ways of speaking to that young gentleman who was considering cutting down the amount of weed. And you may remember, and I believe it was Forrest who offered this, and tell me if my memory is accurate, but you may remember that Forrest suggested that we affirm his strengths at first. And somebody else suggested that we use an open-ended question. And then somebody else suggested we use a reflection. So there are, yes, and we talked about those high vibrational, absolutely. That's what we want to bring. That's MI spirit, MI consistent approach. That energy, the high vibrations, the collaborative partnership. So there is not any one way, and we have a number of tools, but what we know, and we know that we are intentionally guiding the conversation to explore the ambivalence about that behavioral change goal, and that we are helping that person to identify their desire, their ability, their reasons, or their need to make this particular change. Okay? I will also just underline before I share a quick scenario with you, and then we're going to look at that first part of that video, is that there are three essential parts of the practice of motivational interviewing. We've already talked about MI spirit, or the MI consistent approach. There are then the four tasks, the work that we're doing when we're practicing motivational interviewing. And then, of course, there are ORs, the core communication skills, which most of the training that are on MI focuses a lot of attention on ORs and giving people the opportunity to practice ORs. In fact, when I was in that training of trainers, a couple of those trainers said that they had gone to prior trainings on motivational interviewing, and they said they spent hours and hours on practicing, identifying, and again, those aren't bad things, but they mislead what's most important to the practice of motivational interviewing. They're simply ORs, or simply tools and skills that we use in order to explore ambivalence, evoke and employ change talk, which is the person's motivation. Now I'm going to stop sharing my screen for a minute. And I just want to share a scenario with you. It's a new scenario. And I'm intentionally sharing this scenario because I'm going to ask you to guess about something. Okay? So I want you to put your best thinking in place to guess about something. Okay? So I was engaged in an MI conversation with somebody, and the behavioral change goal that this woman that I was talking with was that her current behavior was that she was smoking 2 packs of cigarettes a day, which was 40 cigarettes. That was her consistent practice. She was smoking 2 packs, 40 cigarettes a day. And she told me that the behavioral change goal that she was considering, and to reference stages of change, and I think it was Val who brought this up, the stages of change model, the trans-theoretical model, if somebody's considering a change, they are in contemplation. And it's often where their ambivalence is the highest. And we know that if somebody is ambivalent about a particular behavioral change goal, OPP, ka-ching, it's an opportunity to practice motivational interviewing. Now, what I'm asking you to use your best thinking on, and let's hear from as many people as possible about this, her goal was to move from 40 cigarettes a day to 15. She wanted to cut down to 15 cigarettes a day. And Solana, I'm thinking of you as I say this, because that's another quintessential example of a harm reduction goal. She wanted to continue to smoke. She wasn't giving up smoking, but her goal was to go from 40 to 15. Now, here's where I'm asking you to guess. Why do you think she was considering this change? Does anybody have any thoughts about that? Does anybody want to offer a guess as to why she was considering that change? And I am asking you to guess. I was in a real conversation. Yeah, go ahead, Samantha. Go ahead. What do you think?
I mean, less cigarettes is better than more, right? So even someone who doesn't have a lot of education, they know cigarettes aren't great for you. So the less you can do, maybe she thought she was at a point where she could handle getting to 15.
Got it. Got it. So somehow less was going to be better, and she could handle cutting it down to 15. Okay. I'm seeing a number of things in the chat. Health, family, finance, cost to improve her health, health reasons, family, some kind of health issue, health and finances to save money, Celeste says with an exclamation point. Health and expenses. Yeah. You know, I'll throw, does anybody want to throw out anything else? Because I've one that popped into my head that somebody has shared in the past, which I thought was really fat. Go ahead, Craig. What do you think?
maybe she went to a doctor and had a meaningful conversation and she realized that this is something I have to do.
Okay. So a post-medical, and Forrest is really good at reading my mind. Forrest just wrote in the chat, the smell, because some people have said that maybe like she got feedback that she smelled bad, like she smelled like smoke, or her breath smelled like smoke, and that's making her uncomfortable. Parvin writes, behavior modification, high risk to low risk health factors. Yes, very similar to what Samantha just said. The idea that less cigarettes is maybe causing less of a health problem. And I don't want to lose sight of what Craig just said too, because Craig, sometimes this is how people will consider a behavior change. That and I love the way you put it. Yeah, maybe she entered a bet and somebody said, I bet you can. And she said, I bet I can. Craig was maybe Craig was whatever motivates her, right? You know, that cash prize at the end. I don't know. But Craig is acknowledging that maybe she had a meaningful conversation with a healthcare provider and it left her thinking. And also, Forrest, you're acknowledging that maybe it's just her path. That's, it's her path. So I was actually in a conversation with her. And by the way, this conversation was recorded. There was an audio recording made of it. Okay. Because my MI practice was being reviewed and coded. So it was recorded. So I actually know why she was considering cutting down. Do you want me to tell you? Are you sure? Okay. Forrest is like, go ahead, Forrest. What do you want to say to me?
That's her confidentiality, and let it stay there.
Well, I have permission to share.
Okay. If you got permission, go ahead and
I
share.
do.
But that's her confidentiality.
You're absolutely right. You're absolutely right. And thank you so much for saying that. Forrest, thank you. And that is so client-centered. Fantastic. So I do have permission to share this. Yeah. So yeah, and Val noting 15 ? One every other day, not a daily smoker for insurance and work. Yeah. And Nikki writes, how does she want to have to go outside as often? Yes, Nikki, that's another thing that often comes up when I ask people to consider what may be her motivations. But I will remind you, I was actually in a real conversation with her. Okay. And by the way, it was recorded, and that's why I know. So this is what she told me, folks. She said to me that she and her 6-year-old daughter were watching TV together. They were sitting in their living room, and she was sitting on the love seat, and her 6-year-old daughter was sitting in a side chair. And they were watching this comedy program, and they were really enjoying it, and they were laughing and really enjoying the comedy program. And she said a commercial came on. And guess what kind of commercial it was? Yep, exactly, Forrest. But it was one of those particularly graphic ones where the person had the tips of their fingers cut off, where they had a tracheotomy, and where they were dragging an oxygen tank. So it was particularly intense. She said that during that commercial, neither she nor her daughter said a word to each other. And then the comedy show came back on and they were watching it again. She said a few minutes after the commercial, she didn't realize it, but her daughter had gotten up and gotten out of the chair and come right over next to her. And she realized it all of a sudden that her daughter was standing right next to her. She was so quiet, she didn't even hear her get up. And she said that her daughter took her hand and she put it on her mother's hand, and she looked her mother in the eye, and she said, "Mommy, I don't want you to die." That's why she was considering making this change, because of that moment. Yeah, kids will get you every time. Well, again, it was clearly a motivation for her. So there are a couple of things I want you to keep in mind about this, and we're going to come back to this scenario in part 3. But there are a couple of things I want you to keep in mind. Remember, I was practicing motivational interviewing. The audio recording was going. That's the story she told me. Now, what I want you to consider is, what do you think I did next? I don't want you to comment on that now, but I want you to be contemplating that. What do you think I did next? Now, some people can't help themselves and they might yell out, did you cry? Because it was very intense. I don't know if you can feel that as I tell you that story, but it was very intense. So I want you to be thinking about that, and we're going to come back to that in part 3. Okay? We're going to come back to this scenario in part 3, because I want you to be thinking about it from a practice perspective, in terms of how we could potentially be practicing motivational interviewing. And we know that this was an opportunity to do so, because this was a behavior change that she felt ambivalent about. Part of her wanted to make this change, and another part of her did not want to make this change. Okay? So I want you to be thinking about that. I just wanted to lay the foundation for that. And we're going to come back to it in part 3. Okay? Yeah. All right. Thank you. So I'm going to share my screen just one more time. And then we're going to go back to that beginning part of the first video, the dentist video. So I underlined, folks, that there are these 3 major components that are essential parts to the practice of motivational interviewing. The thing you want to keep in mind, and this is so relevant, this is so relevant to the video that we saw, is that your interpersonal relationship, your collaborative engagement or rapport with the client, with the practice of motivational interviewing, with an MI consistent approach or MI spirit, is your most powerful tool. Please keep that in mind. When that relationship, there's discord in it or there's disconnect in it, it's very difficult to go forward until that's adjusted. And again, I hope you can see me. I can't see you, but I'm going to do a gesture and I want you to type the first phrase that comes into your mind. If there's discord in the relationship, or there is a lack of partnership, you can always do this. And what does that mean? Type that into the chat. What does this mean? And type it into the chat. And let's see if anybody remembers what that means. Yes, it means course correction. Yes, or course adjust. I'll accept course adjust. CC, I'll even suggest course correction. Excellent. Yes. So keep in mind, folks, motivational interviewing is not brittle. It's not fragile. We make missteps And when we get that feedback and we know it, we can course correct. Now, and truly, Forrest, it is nonlinear because we can go back and repair and build rapport when that's necessary to go forward. Okay? So I'm going to share the first part of the video. Now, I want you to watch for something in particular. And I'm going to, we're not going to watch the whole video, but I'm going to stop it at a particular point. And this is the thing I want you to watch for. And I want you to, I'm going to phrase the question this way. I want you to watch for and determine for yourself is what did the dentist do that evoked the sustain talk and created the discord? What did the dentist do that evoked the sustain talk or created the discord? And I want you to be watching for that in the video. Okay? And, you know, we're 36 people strong in this learning community, so we may have 36 different perspectives, and I want to respect that, but I'm going to ask everybody to watch for that. Now, if I've stopped the video, it means that that has happened. Okay? So pay attention from the very beginning to when I stop the video. Okay? You're watching for what either evoked sustained talk from the patient. And remember, sustained talk is anything that the lady with the pearls says that keeps her smoking cigarillos. And discord is anything that that challenges the partnership, the collaboration of their collaborative partnership. Okay? So that's what I'm asking you to watch for. Here comes the video, I hope. And then we'll discuss it. Here we go. And again, remember, we're not going to watch the whole thing, and I'm going to stop it after sort of what I'm asking you to look for has happened. And I want you to frame for yourself specifically, what is it that the dentist did or said that evoked sustained talk or created discord? Here we go.
Okay, so finish the exam. Have some good news and they have some not so good news. Looks like you don't have any cavities, so that's the good news.
That's great.
However, I'm pretty concerned about something I'm noticing in your mouth. Actually, if you look up here, the roof of your mouth, I'm noticing a lot of irritation that's really consistent with tobacco use. And you had said on your form that you're not a tobacco user, so I'm just wondering what's going on.
I don't smoke cigarettes.
Okay. Well, as I said, there's a lot of irritation, in particular, like I was mentioning, up here in the roof of your mouth. It's turned really deathly white colored, and there's little red spots. And you probably didn't notice because we don't spend a lot of time looking at the roof of our mouth. But you're really damaging this tissue in your mouth, which can really cause some severe problems in terms of your oral health. It's called nicotinic stomatitis, and this is something we don't see in any patients who don't use tobacco. So maybe you're not smoking cigarettes. Are you smoking a pipe or cigars, or is there something else that could be contributing to this? Because I don't know what else might be causing it.
Well, the only thing, I've never smoked cigarettes ever. But when I go out with my friends, we like to go to, we like to go out to lounges and sometimes there are those nice young men that gift you different sorts of things. And we got some of those mini cigars, that Swisher Sweets. They come in peach and grape. And that's the only time that really, I've ever really used anything that's got tobacco in it.
Okay. So I think that's a pretty common misconception because they're fruit flavored. People think they're okay. Those are really bad for you. Did you know that?
Really bad, but they're just little mini, little cute, little girly cigars.
Right. They're still cigars and they're still tobacco. And so they still cause lung cancer, oral cancer, emphysema, all those same kinds of things that you would see with cigarettes.
Well, I
So it's
only
really
use them
important.
just to relax. I mean, it's not like it's something that I would smoke 20 or 30 cigarettes a day.
So I want to share, before I invite you to share your observation, I want to share something with you that I actually have never realized before. And I want you to know that you inspired me to want to show this video, this part again, because I reflected a lot on your reactions to it. And you really prompted me, your insight prompted me to want to share this part of it with you again. I want to thank you for the fact that I never realized what we saw was a little over 3 minutes. I never realized that one whole third of this video, before certain behaviors and events occurred, one whole third of this video, there could have been an opportunity to practice motivational interviewing. One whole third. So I'm stunned. I never realized that it was that much. It always seems like it's much shorter, but it's actually much longer. And then it all sort of, yeah, many opportunities, Forrest. Agreed. So I asked you to look specifically for what did the dentist say or do that caused sustained talk or caused discord in the relationship. Does anybody want to unmute and share their observation with us? Samantha just wrote something in the chat. So let's start with what Samantha wrote in the chat, and then we'll see if anybody wants. And Solana just did too. So let's see if anybody will unmute and elaborate. Maybe Samantha or Solana will elaborate too.
Yeah, I mean, I think we kind of said the same thing or on the same track, but
go ahead.
It's like how she said, those are really bad for you. Like she just started to like go in on her at that moment. And I think too, that's when the patient started to kind of seem to shift gears as well and seem a little more defensive.
Okay. So I'm wondering if I can ask Samantha and Solana a specific question, and then we're going to come back to what Forrest put in the chat too. But I want to ask Solana and Samantha a very specific question. And if you don't want to answer this, please pass. But I want to throw it out to invite each of you to answer it. What indicated to you that phrase, those are really bad for you, and that tone, what indicated to you that something had changed in the patient? What did you observe or see that indicated, or what did you hear that indicated that something had changed? So that's, and I'm throwing that out to you because you're noting this very specific thing, but then we can open it up to anybody else too. But what did you?
I mean, so she started before it saying something to the effect of like, that's a common misconception, like kind of more open and having that MI energy to it of like positive. And then she's like, but those are bad for you. Like it just shifted completely. And the patient was like, well, what do you mean? Like that was when she started to kind of shift her tone as well.
Understood. So you heard a tonal shift. Now, I don't know if you've been able to see the chat because people are like putting in the chat, and so many people are noticing the nonverbal communication when she crossed her arms. And not only did physically, and Solana, would you add anything or would you highlight both the tone and the crossed arms?
Yeah, I mean, what I had said in the chat was she kind of sat back, like distanced herself from the person, which, you know, formerly they were like fairly close, and then she crossed her arms, her tone completely changed. Yeah, I mean, it was both.
Yeah, it's a powerful example. And I love the fact, Solana, that you added another level to it of not only did she cross her arms, but she also moved back away from the dentist. She created space between the two. And why does somebody do that?
They're uncomfortable.
Yes. And they're uncomfortable with what?
You. They're uncomfortable with you.
They're uncomfortable with you. Yes. They're uncomfortable with you. They're uncomfortable with your approach. And Val, thank you so much. They feel attacked. Go ahead, Forrest. Go ahead.
I could take it back further than that, when she actually rolled her eyes when she said, "Are you sure you're not smoking?" She went, "What?" Like, like, are you serious? That's how she looked at her. I noticed that when she said, "Are you sure you're not smoking?" She
Yes.
rolled her eyes at her.
Yeah. Are you sure you're not smoking? She told her, I'm not a smoker. Yes. Yes. So folks, I really wanted us to look at this. And again, I am really I'm really excited to realize that it's much longer in the video, that before the, her reacting, the creating space, feeling to defend herself, needing, but the foundation of it is even earlier, which is what you're pointing out for us, that like you can see that there are trouble signs, but it doesn't really turn into discord until those are really bad for you. That's tone of voice, and that's also, what was that, Forrest?
I said tone and texture. It's the texture and the tone and how you
Yes.
present it. You can say what you want to say. It's just how you put it out there.
How you put it out there. Yes. Yes. And Val just writes, implied she is a liar, called out the questionnaire, non-smoker. Yeah, she didn't say this, but Val inspires me to want to try and put on my evil hat, which is, she could have sort of said like, so your questionnaire says non-smoker. Tell me how somebody who smokes cigarillos is a non-smoker. Which would, in essence, what she was kind of doing, confronting her that way. Okay? And again, we can see it non-verbally. We can hear it in the tone of her voice. Does anybody else want to comment on what I asked you to observe? And feel free to unmute. Feel free to put it in the chat. Does anybody else want to comment or underline anything that we've already noted in terms of what you may have observed? Can't hear you, Forrest, if you're talking.
Okay, so now I'm putting myself in the position of the patient, right?
Okay.
And what if this was a person of color? Right? Now I'm adding another spin onto it. And I'm thinking, like, how would this have been received? Right?
Yes.
Are you talking to me like this because I'm low income? Are you talking to me like this because you think that I'm not smart? Because she did use a lot of technical terms in the way that she was talking to her. I don't know. Like I said, for me, I think of things like how I would want to be talked to, or how I would. Now I've just unpeeled the onion a little bit and put more layers on it.
Yeah, and it really does speak to the multi-dimensional person that we have in front of us, because based on their experience, they could interpret this in a lot of different ways and could experience it in a lot of different ways. Absolutely. Anything else that anybody wants to underline in regard to this? I'd like to underline two things. Thing one, to me, and we're going to look at what Nikki just wrote in the chat. To me, this is a powerful example of how not attending to nonverbal communication can be very problematic. Because this person was clearly giving nonverbal communication, and the dentist didn't seem to be attending to that on any level, and actually got increasingly more aggressive. To me, it's also a powerful example of how one's tone of voice, one's desire to fix, can actually push the patient further and further away, and possibly out the door and never coming back. So let me just take a quick look at what Nikki wrote in the chat. The fact that she immediately said, "Those are bad for you," rather that it was acknowledging it was good only using tobacco on occasion and not smoking regularly. So Nikki, really great point, and throwing away an opportunity to affirm a strength. Because there is a strength in, like, okay, well, you made a decision not to be a heavy smoker or a daily smoker or whatever. You must care about your health. Okay? So again, focusing on, like, I need to educate you that these are bad. Now, let me ask you this. Let me ask everybody in the learning community this. And if you're aware of this, type the letter A. If this is new to you, type the letter N. Okay? And let me ask it first. And we have 36 people in the learning community. Of the 36 of us that are here, are you aware of the fact that smoking cigarettes can have the potential of creating some sort of illnesses or diseases? Are you aware of that? Have you ever heard that before? Or if that's completely new to you, type the letter N in the chat. Okay, so far, I just saw a whole, like, line of A's. So it seems that out of the 36 people, and for everybody who's responded, that everybody knows that there can potentially, not for everybody, but potentially there can be some health concerns related to smoking cigarettes or the use of tobacco. Okay? Now, is it fair to say, and you can nod, you don't have to type anything in the chat, but is it fair to say that that lady with the pearls may also be aware of the fact that smoking, using tobacco or smoking, could potentially cause health problems? Is it fair to say that that lady in the chair knows that? And Eula types a Y in the chat, that yes, which may be the reason, oh, I saw somebody added something there, which may be the reason why she does not smoke. Yes, she made a decision not to smoke cigarettes. She doesn't see a cigarillo in the same way. Okay? The dentist has made it very clear to her, those are bad for her. Go ahead, Forrest. Go ahead.
Okay, because now I feel like
we're in what?
The beliefs, right? She doesn't believe that she's a smoker. So how can I tell her that she's a smoker if she doesn't believe that she's a smoker? Case in point, when I was a little kid, I believed that if you cut a sandwich in kitty corner, it was bigger than if you cut it straight down the middle. But that's just because I believed that. You understand what I'm saying?
I do. I love the example. Yes.
She doesn't believe that she's a smoker. So how can I tell her that she's a smoker if she don't believe it?
Forrest, we have even gotten closer to my desire to show you this second video. And I'm gonna in a moment conduct a vote for everybody who wants to see the second video, or if you want to wait for part 3. So it'll be a very interesting and I'll do an entirely non-scientific analysis of your votes to see if I show the video or not. But what Forrest just said, at our peril, you didn't say this, Forrest, but tell me if you're okay with me adding it. At our peril as the worker, we ignore the beliefs of the person sitting in front of us. And at our, you're okay with that, Forrest? Okay. At our peril, we ignore and dismiss the beliefs of the person in front of us because we know better. At our peril. And what I mean by that, folks, is we're not as effective as we can be. We can turn this person off. I saw something else came in the chat. I just want to make sure I see it. Salon, okay, not a problem, Salon. Thanks for letting me know. And some people consider a smoker not just occasionally, and some people consider a smoker not just doing occasionally or once. Can you elaborate on that? I think I understand what you mean. And I don't know if you can unmute, but if you can, if you could elaborate on that, or if you need to type it in the chat, if you could elaborate.
Sorry, that's me, right?
Yeah, go ahead.
So you know how they ask like questions like, "Are you a smoker occasionally?" So
Oh,
you
I
know
see.
how they have their numbers and stuff.
Yeah.
So occasionally or smoking once, that's not really. If I've smoked once, I wouldn't say I'm a smoker. Like that's just like drinking. If I drink once, no, I'm not a drinker. I had a drink,
Right.
but
Right.
I'm not a smoker or drinker, you know.
Right.
And so,
right.
whereas if there was a chart, that's something you might have should have looked at the chart and see what the lady chose on the chart as well.
Absolutely, such a great point. And all we know is that the questionnaire said, "Are you a smoker?" And back to what Forrest is saying about beliefs, this woman's belief is that if she's not smoking cigarettes, she's not smoking. She's a non-smoker.
She could be smoking weed, and to her, she's not a smoker.
Bingo. And I'm so glad you said that, Forrest, because I hope every time I watch this video, and I've watched it, as I said, over 700 times, I think, every time I watch this video, when the dentist says to her, she says, I chose no because I'm not a smoker. I don't smoke cigarettes. Every time she says that, I keep thinking she's going to say, but I do smoke weed, but she never does. But I keep thinking the video is going to change and she's going to say that she smokes weed, which also prompts me to want to show you the second video, because the only thing I'm going to tell you about it is that we find out more. Because her approach, and we're not going to, I'm sorry to disappoint you, we're not going to find out that she smokes weed, but we are going to find out, because that would be full circle with our young gentleman who's considering cutting down the amount of weed. It's not that neat, but we do find out more about her smoking habits. And Val writes, symptoms probably indicate regular use. Well, fascinating, because that's the conclusion that the dentist is making. The dentist is saying, hey, you've developed a case of nicotinic stomatitis. And what that indicates to me is that you are a regular smoker. You're a smoker. And we see what road that led us down in the first video. So Kristen writes, yes, the dentist told her that you are doing damage to your mouth. True, ignoring that the woman said she doesn't smoke. Right. Then it depends on what you smoke is out of. Then it depends on what you smoke it out of too. Yes, because you might be using a water pipe. You might be using whatever. Absolutely. So I'm going to share
so many variables at this point that you're throwing into the mix without you even asking questions.
Yes, and I love that Forrest just said that. There are so many variables at this point, and unless we ask, we don't know. And this is where curiosity comes back. And curiosity is different than attack or judgment. Curiosity is an invitation to try and understand. Try to see it from the lady with the pearls perspective. Okay? Yes, she says she goes to smoking lounges. Yes, we did find that out. And we are about to find out more. So let me just ask, because I do want to share my screen with you, and I do want to just cover quickly one other slide, or maybe two. But let me ask you this. This is where you get to vote. Do you want to see the companion video today? If you want to see the companion video today, type yes in the chat. If you want to wait until part 3, Forrest says today. Okay. Forrest vigorously says today.
Because I'm interested.
Okay. Excellent. Passive smoke in the environment, Val is suggesting. It's possible, Val. We need to find out more. Okay. So far, everybody who has voted, and let's hear from everybody if we can, but so far, everybody who has voted has said yes, they want to see the second video. Okay. I'm okay. And Marissa just voted yes too. Marissa, you just tipped the balance. I think we're going to see the second video today. So let me quickly share my. Eula just said yes. Eula, definitely you tipped the balance. So let me just quickly share my screen with you, and then I will make sure I tee up that video. So remember, we said this idea. A very important point here. People often mistake client-centered counseling for the same thing as motivational interviewing. It is not. Motivational interviewing is client-centered by its nature, the practice of MI, and of course an MI consistent approach, because partnership, acceptance, compassion, and empowerment is what defines an MI consistent approach. So it is not the same thing as client-centered counseling. Client-centered counseling is much more following as opposed to walking side by side with and guiding. And it is not the trans-theoretical model. Remember, the stages of change model by Prochaska and DiClemente, it came out in 1983, about the same time MI did. But this model helps us understand the process of change. It is not telling us how to communicate with somebody about change to explore and resolve their ambivalence and to increase their motivation. We also noted that when someone is in the stage of change of contemplation, part of them wants to make the change, part of them doesn't want to make the change. That's probably where their ambivalence is the highest. We know that OPP, opportunity, it's an opportunity to practice motivational interviewing. I'm going to pause the slides here for a minute because I am going to find the other video and we're going to watch that right now. And I just found it. And I'm going to just let it scroll through this commercial. Excellent. I'm just queuing it up. Excellent. It's all queued up. So now, folks, I am going to share this video. I just want you to watch it. Whatever reaction you have is the reaction you have. We'll talk about it. And we will come back to it in part 3, in addition to the lady who was considering cutting down from 40 cigarettes a day to 15. Remember, we're going to come back to that in part 3 as well. Okay? So now I'm going to show you the video. I can't thank you enough. And here we go. Oh, hold on a second. It looks like it's showing the wrong bit. Hold on just one second. I don't want to show you the. Here it is. Okay. Okay. I've got it now, hopefully. Okay, here we go. and you're just watching it, just whatever reaction you have.
Okay, hard part's over. So the good news is no cavities.
Oh, great.
Yes, always happy to hear that. I do have some concerns though, because I'm seeing some irritation in your mouth and the palate that's called nicotinic stomatitis.
Oh, that
And
sounds bad.
yeah, it is. It's some damage to the roof of your mouth that happens from tobacco smoking. And so I'm wondering if you can tell me a little bit about how tobacco fits in your life right now.
Tobacco? I mean, I don't smoke cigarettes. I've never smoked cigarettes. I do go out with my friends. We go out to bars and, we'll have a few drinks and smoke some of those little cigarillo type things. I mean, I don't even think of them as cigars, and they're certainly not cigarettes. And I mean, I'll have one or two of those in an evening with my friends, but certainly not 20 or 30 of them a day like you would with cigarettes. And that's the only thing that could possibly have anything to do with tobacco.
So you've made a decision in your life not to smoke cigarettes. It's something you didn't want to do. It sounds like you're kind of concerned about the health effects of cigarettes, but you have been smoking the little cigarillos at least one or two every time you go out.
Right, but that's just like a social thing. That's something that my friends and I do. We it's not a habit or something that I have to have. And, talking about one or two when we go out for an evening, not packs of them.
Yeah, so you're not like those chain smokers. You're not smoking packs and packs a
No,
day.
no.
The amount you smoke is so minuscule you can't even imagine that it would cause any harm. And yet here it is damaging the roof of your mouth.
Well, you have a point there. Now that you mention it, I have started having one or two at work, when we have breaks, because I have a couple of friends at work that smoke. And so every time we have a break, we all go out to the break place outside. And so I go with them, and I have one of these Swisher Sweets. I like the peach flavor the best. They're so cute. But that's really only pretty recently.
So smoking has kind of become a big part of your social life now. When you go out, you're smoking, and even during breaks at work, you're smoking.
Well, yeah. Now that you say it like that, it's true. I am smoking on a daily basis.
So aside from that social aspect, what are the things you like about it?
Well, it's relaxing, and it's just nice to be with people. And when I like to go to Las Vegas, and so when we go to Vegas, it's really fun to go to the cigar bars. It's kind of sophisticated and fun, and so it's mostly a social thing.
Okay.
I mean, I wouldn't say I was a chain smoker.
Okay, how about the other side? Have you noticed any not so good things about the smoking?
Well, I was going to ask you about whitening my teeth, because I've noticed that they have more stains on them than a few years ago. And so I imagine that has something to do with the smoking.
Yeah, so we're noticing some pretty negative effects in terms of your oral health with the smoking. Are there any other things that you're concerned about?
Well, there's the expense, what with the economy and all, I've had to be careful about my money. And so there is the extra expense of, because I'm buying more of them than I used to. So the money aspect is also a concern.
So there's your oral health, there's the financial aspect, and then earlier you brought up some concerns about smoking cigarettes and how that can be harmful for you.
Oh, yeah.
Were you aware of the fact that smoking these little cigarillos, the Swisher Sweets, can have some of the same negative health effects?
Oh, absolutely not. I mean, I thought of it more as a fun thing to do with my friends, certainly not a smoking habit or anything that would be harmful.
So it's kind of surprising to you that something you've been doing, and you've been doing more and more of it, is actually pretty bad for you.
Oh, yes. I checked the box on your form when you asked if I used tobacco. I checked no, because I never thought of myself as a smoker.
Well, what do you kind of make of that now that you realize that you're actually a tobacco user and that you might actually be causing some pretty serious health effects.
I'm really concerned. I mean, I don't want to develop cancer, lung cancer, or any of the awful things that happen from smoking. And, really, until this conversation, I never really thought of myself as a smoker at all. So I'm very concerned.
Well, the good news is, in terms of the nicotinic stomatitis, at the point in which you stop smoking, you can actually reverse all the negative effects that occurred. And you might also know that you can stop the progression of any other diseases that had started just by quitting smoking.
Really?
Yeah, is that something you'd be interested in?
Oh, I would. I really would. Because, like I said, I'm a brand new smoker. I didn't know I was a smoker until I came to see you.
Well, if you think about it on a scale of 1 to 10, where 1 is really don't think you could do it at all, and 10 is really confident that you could quit if you tried, where do you think you fall?
Oh, I think I'd probably be in 7 or 8. I'm pretty confident that I could stop doing this.
Okay. What made you choose 7 or 8 as opposed to a 5?
Because it's not a part of my daily life. I don't have to have a smoke when I get up in the morning. I don't smoke 20 or 30 of them a day, so it's not that much exposure, and I'm pretty confident that I could stop.
So it sounds like, just to kind of summarize, you've noticed some negative effects of the smoking. You have some concerns about health effects that could occur. There's the financial aspect, and yet you feel pretty confident that you could quit if you tried. So where do you think we should go from here?
I'd really like some more information about quitting. I mean, I've heard there's some new medications, there's some new things that can be done to help people make quitting more comfortable, and I really want to quit.
Okay, well, I'd be happy to talk to you more about that and give you some tips and advice and give you some suggestions about where you can get some support with quitting.
Oh, that'd be wonderful.
I really appreciate you talking to me about this today.
Thank you.
No, thank you for watching that video. I really appreciate you watching that video today. So, frame for yourself any reaction or any thought you have. And Taryn just wrote in the chat. Let's read what people have written. Listening to the patient. Yep. Restating what the patient is communicating. Patient education was there. The provider was much more patient, and the patient meeting her where she is and at her readiness to change. Okay, that was a lot in a very concise sentence. Craig writes, dentist is actively listening. I'm not surprised, Craig, that you're featuring her active listening there. Using reflection, empathy, and seeing how the patient wants to proceed. Meeting the patient where she is at without telling her what to do, and as well as holding the patient accountable versus making her accountable. Christina writes, breath of fresh air. Good, I'm very glad. A lot of summarizing throughout, much better communication, very affirming, very curious, MI spirit all throughout. Yes. Forrest gives applause. Emma engaged the patient in a more productive way, non-judgmental, eye contact. Fantastic. Nikki writes, she asked about the role of tobacco in her life and waited for her to elaborate on her own. Nikki, I'm so glad you pointed that out. Because I want to underline, folks, that is a beautiful example that Nikki has so insightfully underlined, and I imagine other people heard that too. That is a beautiful example of the intentional use of a non-judgmental, open-ended question. And don't lose sight of the fact that Nikki just also acknowledged that she asked that question. So tell me a little bit about how tobacco fits into your life. And then she shut up. She let her answer. And there was a little bit of, there was a little bit of that and a little bit of awkward silence. But the dentist trusted her curious, non-judgmental open-ended question. Nikki, is there anything you would add about that? Is there anything else you want to underline about why that particularly stood out to you?
I mean, that stood out to me because I think it was the turning point and where the two different avenues we saw diverged.
Yes, thank you. And what a beautiful and poetic way to put it. It was the turning point of where we saw the two different avenues. And look at what a non-judgmental, am I spirited, am I consistent approach linked with an effective, non-judgmental, open-ended question. Look at where it led to. Now, tell me, folks, was I kidding when I said we're going to find out a lot more? I was not kidding. This lady goes to Vegas and cigar bars, and now she's smoking on breaks. We didn't know any of that in the first conversation. And it had everything to do with the dentist's approach. Is there anything else specifically? Because Nikki, you really started us with looking very intentionally at the tool that the dentist used in that particular moment. Are there any other moments that particularly jumped out to where you saw the dentist, and some of you have referred to it, active listening, all of those reflections, all of those things. She allowed the patient to think about what she said and why, and what direction that she wanted, and it's cut off, but I'm going to finish what you said, where she wanted to go, then provided resources. Absolutely. Is there anybody else who wants to bring us back to a specific reflection, comment, question that the dentist offered that jumped out to you? Just like Nikki is saying, the open-ended question. Samantha writes, the self-assessment of patients' confidence to change at the end. Samantha, can you say a little bit more about that? I think I know exactly what you're talking about, but if you would.
Yeah, towards the end when she asked, like, how confident are you that you could change? Because it was clear that she wanted to change, but wanting to change and having the confidence to change are two very different things.
Two very different things. And just to put a practice tag like we did with what Nikki observed, putting a practice tag on what Samantha observed, that is an intentional, open-ended question focused on confidence related to the particular behavior change. And it evokes change talk. It's intentional because does anybody recall, and Samantha, maybe you do, but I'm wondering if anybody else does anybody recall the question that followed the question about her level of confidence?
Yeah, so she had said, I think 7 or 8, and then the dentist said, why are you not saying 5 or something to that effect? I don't remember the exact question, but.
Yes, I think you just remembered it exactly.
Okay.
So yeah, it was definitely, Forrest is saying it was definitely lower, and you're both absolutely right. But my question is, why did the dentist do that? Because I want to underline something for you folks. That was intentional. The dentist did that intentionally. So why did she do that?
Because she knows that smoking is difficult, and there's people out there who do struggle with smoking. So let me gauge and see where you are and find out how comfortable you are in being able to quit.
Absolutely, Forrest is right. And the question I'm asking us to further kind of look under is the first question does that. It's assessing her confidence. And she said a 7 or an 8. Okay? That's pretty darn high if you think about it. On that scale, she said a 7 or an 8. The dentist intentionally said to her, why not a 4 or a 5? My question to you is why did the dentist intentionally do that? Any thoughts? And I think Nikki put something in the chat, so let me check. She wanted to understand where her confidence is coming from. Yes. She wanted to understand where the confidence is coming from, i.e., her strength, her motivation, her change talk. Yes, it's a way to evoke change talk because we understand where the confidence is coming from. She was prompting her to put a why to her confidence and readiness to change. Yes, Taryn, absolutely. Folks, we are at the top of the hour, 1 minute from the top of the hour. I'm going to ask you to do what I asked you to do for the last time. It is all, you're absolutely right, Forrest. It is a way to affirm her as well because it affirms her strengths. You're right.
But it's a way for her to affirm herself.
Yes.
For her to do it.
That's right.
For her to do it.
That's right. That's right. And that's what MI is. That's what MI is. So, folks, I cannot thank you enough. I'm looking forward to our part 3. You know where we're going to begin. Have a wonderful and safe afternoon, and we'll see you at part 3. Good morning. I'm very curious to everybody who's here. If you, good morning, Emma. If you consider yourself a morning person, yeah, you can nod yes. And if you consider yourself not, I'm a morning person too. I consider myself a morning person. But if you're not a morning person, if you're more of a night owl, you can give like a nod too. If you're more of a night owl. Okay, Jonathan, more of a night owl. Okay, Vincent, more of a night owl. Okay, all right. And Jose as well. All right. Yes, and please follow Dawn's excellent example. Type your full name into the chat and where you're from. And if you are sharing your computer, like we always do, please make sure that you type their full name into the chat as well. And we'll give it just a few more minutes and then we'll go ahead and get started. And I will refresh your memory as you're typing your name in and as you're pondering. We are going to talk a little more about the woman who was considering going from 40 cigarettes a day to 15. We're going to talk a little bit more about that. And we're also going to talk a little more about the second dentist video. So just to refresh your mind in regard to that. Guidelines from parts 1 and 2 remain the same. If you do need to step away for a moment and turn your camera off, that's absolutely fine. Just send me a private message. Let me know you're stepping away or that you'll be right back, and then just join us. Again, if you wouldn't mind remaining muted unless you have something you want to say, just so we don't get any background noise. Remember, you can always interrupt me. I would ask, though, if Hannah or anybody else in the learning community has the floor, that you not interrupt Hannah. Let Hannah finish her point, and then if you want to say something, you can. And if we could also just all observe that the guideline of speaking from the I. Can everybody still agree to those guidelines? Wave, nod, throw money. Excellent. Very good. Okay, great. Good. So excellent. Louisa was considering throwing money. I love that.
I had to remember how I did it the last time.
Well, it's okay. If it comes back to you, I'll put my checking account number in the chat. I don't know why I think that's so funny, but I personally think it's funny. I don't know why. I think that actually I know exactly why I think it's funny, because one time I said it during, thank you so much, Celeste. One time, thanks, Jen. Jen figured it out. One time I said that as a joke in a face-to-face training, and somebody actually did throw money. They had like coins and they threw a coin, and I caught it, and everybody in the training thought like, oh my God, this guy has like spidey sense or something like that. He can sense, a coin. And I opened my hand, and guess how much money it was? Does anybody want to guess? $5. No. Or 5 cents. Is that what you mean? 5 cents? Anybody, any thoughts about how much money it was?
Was it 100?
Oh, don't I wish? No. It was 1 penny. Yes, it was a penny. but I kept it. It was my lucky penny for that training. So they didn't ask for it back. And hopefully they were throwing it to me, not at me, because there is a difference. So folks, I have been very thoughtful. Our conversations have been very thought-provoking for me in regard to the work that we've done together as a learning community on the practice of motivational interviewing. And to that end, I wanted to go back to the scenario that I told you about the woman who was considering cutting down the amount of cigarettes that she was smoking. And I think you may remember that she was choosing a harm reduction goal because she didn't want to quit completely, but she did want to reach a particular goal of 15 cigarettes a day as opposed to 40. And you may recall also the detail of that this conversation was being recorded. Yeah. Okay. Thanks, Sam. I'm glad you remember. So, excellent. So, the question that I want to throw out to you, remember that the last thing she told me the story about how she and her daughter were watching TV together. That commercial came on, and then her daughter spoke to her. And that's where she ended her client speech. That's what she was saying. So my question to all of you, and I know this may be, I don't know, maybe we should do some kind of warm up before we jump right into this. I think we're ready to jump right into this, though. My question to you is what do you think I did next? Because remember, she and I were engaged in an MI practice conversation because she had an identified behavioral change goal. She was truly ambivalent about it. So what do you think I did next? And I'm gonna invite anybody who wants to throw out on the table. And I can tell you if you want to know, but I want to get a sense of what your thoughts are about what you think I may have done next. And my goal was to practice motivational interviewing specifically in regard to her identified behavioral change goal, which was to cut down. Okay, so Jonathan says lean into the ambivalence. And Jonathan, that's a great description. I'm not exactly sure how I would say that or what I would have said to her. So if you have a thought about what I might have said, Eula suggests asking her what she wants to do now, okay, which would have been an open-ended question. Celeste is, I'm thinking you reflected and focused on her wanting to cut down. Okay, again, another really great description. I'm wondering what that would mean in terms of what I said. Nikki says, ask her what her daughter said affected her. Would you say?
I'd probably say something like,
just say it to me. I'm the client. Just say it to me as if I'm the client.
So it sounds to me like how your daughter reacted really impacted you to want to change some things and to cut down. Can you tell me a little bit more?
Got it. Similar strategy to Emma. Celeste also made the transition into talking directly to the client. She's reflecting back the impact. So it's a simple reflection. It impacted you. And then followed by asking for elaboration. Tell me more. Okay. And let's hear from one other person who has a burning desire to speak to the client and try out what you'd say to the client as well. Don't rush each other. There'll be more than enough time. Who else would speak directly to the client? And what would you say? I can wait. Any thoughts? Nikki's considering it. I can tell. Go ahead, Nikki.
So how did it make you feel hearing your daughter's perspective on your smoking?
Nikki speaking very directly to the client. Excellent transition, Nikki. I also want to underline the strength in your tone of voice. And Nikki simply asking an open-ended question about how I feel, how I might feel about what the daughter said. Ashley writes, I see that you're motivated to make this change. Is there something we can talk about specifically during our sessions that can be helpful? And let's put a practice tag on that too. So Nikki was asking for using a reflection and then asking for, well, actually asking an open-ended question. What's in the chat right now is basically a simple reflection followed by a closed question. Okay? Excellent. So we got 5 on the table. Fantastic. So remember, I said that this conversation was being recorded, yes? Remember I mentioned that? So I know exactly what happened next. Would you like to know what happened next? Okay. 2 or 3 of you do. All right, very good. Maybe more than 2 or 3. All right. Hannah, do you really want to know what happened next?
Yeah, I do.
Okay. Excellent. Hannah, I'm not playing that game. He's either going to tell us or he's not going to tell us. Fantastic. So she said what she said. Now I'm going to tell you what happened next, and then I want you to tell me why I did what I did. Okay? She said what she said, and then I said absolutely nothing. I said nothing. Now, Celeste, I see you shaking your head. What is your thought about my saying nothing? And then maybe we can go to Hannah if Hannah's willing to share a reaction or a thought to that. What do you think, Celeste?
No, I think it's great. I think that as counselors sometimes or in this field, it's a natural reaction to want to fill in the space. Silence can be deafening and it can be uncomfortable, and just allowing ourselves to hold back and allowing for the client to think and waiting on them is a good strategy sometimes. So that was my thought. It's not something I would do right away, but it's a good response. No response.
Okay. Okay. Thank you, Celeste. Hannah, any thought about why I may have made that choice or maybe the impact of that choice?
From what I can tell, it sounds like the client got to a change themselves, and to just appreciate that moment for them, and let them explore that new territory they've achieved.
Yeah, absolutely. And, you know, I really want to underline something that Hannah said, and I'm very curious to hear other people's reactions to my choice at that moment, which, by the way, and I'm going to be very transparent here, it wasn't a conscious choice. It was an instinctual choice. I didn't say, brain, now is the time to say nothing. It just seemed like the right thing to do at that moment. And I want to go back to something that Hannah said, and I hope I'll get the language correct in terms of what you said, Hannah. But you kind of said, like, allowing her the space to appreciate this new kind of territory or this new realization, giving her the space to do that by not saying anything. Did I get that right, Hannah?
I think so.
Okay. All right. Thank you. So Marigold writes, from a PCT standpoint, that is great, but from an MI, wouldn't you need to validate it? Well, interesting, Marigold, because from an MI perspective, my goal is to help explore the ambivalence and to strengthen the motivation. And to Hannah's point, allowing the space for the client to reflect on her own motivation helps strengthen it. Because I could have said something and it could have undercut the power of her motivation at that particular moment. Sam writes, it gives her a moment to quietly reflect on her reasoning and her choice to cut back on smoking. Sam, do you want to add anything to that?
Well, I mean, you kind of just said exactly what I wrote. So
Yeah.
Yeah. So I mean, because what you said about sometimes when someone just keeps going with the conversation, it kind of takes away from that moment, because it's like, okay, now we're moving forward in the conversation instead of just sitting in it and really thinking about it and feeling it.
Yep. Something instinctually told me, do not interrupt this woman at this particular point. This is an important point for her. And I'm thinking of Hannah as I say this. This is a particular point for her to sit with in this moment, uninterrupted. I was present, but I wasn't interjecting at that moment. Jonathan, any thought, any reaction to that? And I don't know if that fulfills kind of the reflection that you gave about leaning into the ambivalence at all, but I'm just wondering if you have any thought about the import of the silence or the work of the silence.
No, I don't have anything to add. I do think like therapeutic silence can be a really useful tool, and I think it's a great way to allow someone the time to reflect on, the sort of any new thresholds that you cross. They can take a second and look back and reflect.
Yeah, thank you. Thanks. So I'll throw out one other thing too, and I'm trying to be very practical / technical as I say this. The story she told me, the one that I told you, that's her client speech. That's her utterance. That's the change talk. So I wanted to let the change talk do its work. It's her change talk. And to Marigold's point, after that moment had passed, I then wanted to employ her change talk. I wanted to put her change talk to work. So she said what she said. I had the instinctual reaction to stay present and attentive and silent. And when that moment had kind of had its weight, and that was a gut thing, it was a feeling shift. When that moment had had its weight, I then said something. Any thoughts on what you think I said? I let the moment have its weight, and then I said something. Remember, I'm practicing motivational interviewing. Marigold is on to something. I let the change talk do its work, and then I said something. What do you think I said? You can put it in the chat. You can unmute.
You probably kind of valid or like said thank you or congratulated her. I don't know the right word I'm trying to think of, but something like in that arena.
Okay.
For getting to that point.
Okay. Okay. Yeah. And what you're really referring to, idea, is the idea of maybe some sort of affirmation. And again, that was a great description. Solana writes in the chat that maybe I asked an open-ended question. How can I support you? Okay. Any other thoughts about what I said next? And don't misunderstand me, folks. Yeah. Christina says that maybe I said, wow, after I wiped the tears from my eyes. Right, Christina? Yeah. Yeah. That's actually not what I said, Christina, but it's certainly what I felt. I'll tell you that much. Any other thoughts about what I said?
Did you acknowledge like how difficult the decision it is, or something along that line, like affirming, like, you know, because it is a difficult decision. So
Sure. And Craig, can I ask you a quick follow-up question?
sure.
So that's a really good description. What do you think, if you were kind of putting that into words to speak to the client, what would you maybe say? And we're in a learning community, so you can, like, you know, practice your way around that. But what do you think you might have said?
First, I just would have said that, I think it's a very difficult decision, and I know it must have taken a lot for you to get to this decision, and just encouraging her to, go on with it, and let her know, like you said, like, how do you think I'd be able to help you, along those lines.
Got it. Got it. Okay. Excellent. Thanks, Craig. Thank you. Okay. Celeste says, did you ask her other benefits she can see from cutting down? Celeste, I did not. And that would have been an open-ended question. And let me, Celeste, I want to add something to my response. I did not. I did not at that moment. Okay? I did not at that moment. I'm going to tell you what I said. And again, I'm going to ask for your reaction to it. Okay? And in addition to your reaction, Hannah says, heck yeah, and then offer a high five. I didn't do that either. So I'm going to tell you what I said. And again, remind you, there's no one right answer here, but I'm going to tell you what I said. And I want you to respond, offer two things if you can. What's the practice tag you'd put on what I said? And why did I say what I said? So the practice tag, what would you call what I did? And why did I say it? So here's what I said. And Solana, I'm going to just look at you, if it's okay, as if I'm speaking to the client. Okay? Is that all right? Okay. So she said what she said. The moment had its weight. And then I said, your daughter doesn't want you to die. That's all I said. So what's the practice tag? And any thoughts, any reactions to why I said that? Complex reflection to drive home her motivation, Celeste says. And actually, Celeste, to put a fine point on it, it's actually a simple reflection, because it's simply reflecting exactly basically what the daughter said. So it's really a simple reflection. Yep. Practice tag, affirming her why. Yes, Taryn. And again, it would be through a simple reflection and restating her own verbiage. Absolutely. And it motivating her to continue her goal. And Craig, what I'm doing is I'm employing her change talk. I'm strengthening her change talk to help her to continue to move toward her goal? Absolutely. I'm helping her to move toward her goal by using her change talk, just with a simple reflection. Your daughter doesn't want you to die. Reiterate her reason through reflection. Absolutely, Emma. It's a reflection, a simple reflection. And you notice I didn't say, your daughter doesn't want you to die. That would have been a question. Notice I didn't also say, what you're telling me is your daughter doesn't want you to die. I also didn't say, what I hear you saying is your daughter doesn't want you to die. I simply said, your daughter doesn't want you to die. Simple reflection. So just keep that in mind, folks. And kind of to underline that, I'm going to share my screen, and there's a particular slide I want to show you at this particular moment. And I'm going to show you this slide, and then we're going to do something as a group together. It's a physical activity. Do not engage in it if it will cause you any discomfort or harm. But I'm going to show you this slide first, and then we'll engage in this physical activity to underline it. So please use the chat to confirm that you can see this big eye and a heart with an ear in it. You can type the letter Y in the chat to confirm that. Very good. So what I want to underline here, folks, is, and this is related to this particular story, that when we're practicing motivational interviewing, we want to be attending on 4 levels simultaneously. We want to be watching the nonverbal communication from the person. We also want to be listening to what they are saying with our ears and what they're not saying. And we also want to be trusting what's going on in our gut. Like, what are we feeling in our gut as we're hearing this person talk and we're in the room with them? So we want to be attending to that person on all 4 of these levels at the same time. So I'm going to take the slide down for a minute so we can engage in the physical activity. And again, only do this if it will not cause you any physical discomfort or harm. But what I'm going to ask everybody to do at this particular moment is point to your eyes, point to your ears, touch your heart on the outside, and touch your belly. And let's do it again. Eyes, ears, heart, belly. Once more. Eyes, ears, heart, belly. Fantastic. Folks, just to remind you that all 4 of those levels of attendance are what we want to bring to the moment. And I imagine, I'm imagining because I don't know completely, but I imagine that the reason my gut told me to shut up was because I could feel in my heart and in my gut the intensity of the change talk that this woman just offered. And my heart and gut said, Paul, keep your mouth shut. And I instinctively knew to do that, to let her be in that moment and to let her change talk do its work. And then because I am practicing motivational interviewing, I employed that simple reflection. Your daughter doesn't want you to die. And then the conversation went on from there. Okay? So I just share that so that we can look at one very narrow slice of how nuanced the practice of motivational interviewing can actually be. So I'm going to pause here for just a moment and ask, are there any thoughts, reactions, comments, questions about what we've talked about so far today in terms of that particular example? Yeah, please go ahead, Karen, go ahead.
So what I'm questioning is, in this particular situation, it seems like the change talk and the open conversation was kind of more like voluntarily given. In motivational interviewing, like in this situation, what if it wasn't? Like it's hard to kind of like give that silence, give that like gut feeling, like let me give you space when they're not giving anything.
Exactly.
And you don't, as like a professional, you don't want it to come off as like I am not like really trying to help you, or I don't know what I'm doing, type of thing.
Yeah. 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 I think if I'm not positive I'm exactly understanding what you're saying, but I think what you're saying is, what if you're in a conversation where the person isn't offering this kind of deep change talk, where they're not so affectively or emotionally connected to what they're saying? So, you don't practice that silence at that particular moment because there's no need for it at that particular moment. Is that in essence what you're saying? Like, what if the moment doesn't really call for that? Is that kind of what you're saying?
Yeah.
Yeah. Which really raises a very important question, that you can only determine what you're going to do next based on what the person is offering you. So your point's a great one. If that's not there, that would be the wrong thing to do.
Mm-hmm.
It would just be this like dead hole. So it's really about what the person is offering you at that particular moment. And you also raise another, I think, critical question, is that before we can practice motivational interviewing, of course, we know there needs to be an identified behavioral change goal that the person feels ambivalent about. So we know that we're not practicing MI unless the person has identified this behavioral change that partly they want to change and another part of them doesn't want to change. What we are doing, if that is not the case, is we are engaging in an MI spirited approach or an MI consistent approach. And that means we are offering that person partnership, acceptance, compassion, and empowerment. And even when we're practicing MI, we're still doing an MI consistent approach. And that's why I said in day one that an MI consistent approach is appropriate for any and every conversation that you have. The practice of MI is not, because there may not be an identified behavioral change goal that the person feels ambivalent about. Any thought or any reaction to that?
I get it. I agree.
Yeah, it's still, you still have a question though about what to do if the person doesn't seem, if they're not offering that change talk.
Well, yeah, I try to feel like in situations like this and trainings like this, and I mean that was a real situation, but like I try to think of what could have happened. Like just like we've seen, like, one turn takes you down like a totally different, experience. So I try to think of all the avenues that, that could happen, and it makes me think, I work with prevention education with the youth a lot. And so it's not cookie cutter with the youth. They're all over the place and they're not usually volunteering, okay, yes, I have this vaping problem, or, so and so wants me to quit and that means a lot to me. Like you're just like not getting that. a lot with the youth, so I'm just trying to think of all avenues.
Yeah, and you're really trying to figure out how could this be beneficial to the clients, the youth that I talk to.
Mm-hmm.
And this is where, folks, I think an am I consistent approach can really be invaluable. And clarify for me, have we reviewed what PACE stands for? PACE, Partnership, Acceptance, Compassion, and Empowerment?
Not in this training.
Okay, I'm going to take a moment to do that now then, if that's okay, because I really want us to be clear about what that distinction is. And this may be something that can be very beneficial for your particular folks. I mean, it's beneficial for any and every conversation you have with another human being. So let's take a moment. I'm going to share my screen and let's take a moment and review that. And I want to bring up the Venn diagram so you can see it. And you will get this. Okay, hold on just a second. You'll get these slides so that you'll have this Venn diagram if it's helpful to you. And we're going to come back to the fixing reflex in a moment. But you'll see here, am I spirit or an am I consistent approach is made up of these 4 domains. And these 4 domains overlap, and they basically give us a roadmap or a definition of how we can choose to be in any and every conversation that we're having with a person. Now, I want to remind you that that does not mean we're practicing motivational interviewing. An am I consistent approach or an am I spirited approach means that we are choosing to interact in a particular way with this particular person. And what I want to do is I want to define each one of these. And what I'm going to ask everybody to do before I take the slide down is type the word in all caps, if you can, the word PACE, P-A-C-E, in the chat. So I'm going to ask every one of us to type that word into the chat. I'm going to do it myself. Type PACE into the chat. There we go. Fantastic. All right, so I'm going to take the slide down. And again, I'm going to remind you folks as we review these 4 domains, an am I consistent approach or am I spirit can be employed, used in any and every conversation that you have. It is not the practice of motivational interviewing. The practice of motivational interviewing means that you're using an am I consistent approach as you talk about an identified behavioral change goal that the person is ambivalent about. You're exploring that ambivalence and you're strengthening their motivations by employing their change talk and evoking change talk. That's the practice of MI. An MI consistent approach, MI spirit, is the way we want to be when we're interacting with someone. Partnership. We want to collaborate with that person. We want to position ourselves as someone walking alongside and working with that person. We are a collaborating guide. Acceptance, and don't make this mistake, acceptance doesn't mean that you're telling the person that they can keep doing what they're doing. Acceptance doesn't mean you're saying to the person, yeah, keep smoking or keep injecting heroin. That's not what acceptance is. In MI, acceptance means very specific things. First, acceptance means that you acknowledge that this person has absolute worth. As a human being, they have value no matter what they've done or no matter what they're doing. Acceptance also means that we are going to affirm any strengths that they have and any efforts that they're making. Acceptance also means that we are going to accept and affirm their autonomy. They get to choose what they want to focus on, what actions, if any, they want to take. And finally, acceptance also means that we are trying to accurately understand. It's called accurate empathy. We're trying to accurately understand the meaning that the person has about the moment. My being silent with the woman who's considering cutting down smoking was a reflection of accurate empathy. I gave the space that was empathic to allow her to be with where she is. Accurate empathy sometimes is a reflection, can be a reflecting of the person's emotion as well. Accurate empathy means you're simply trying to understand it from their perspective and their feelings about it, not what you think is right or what they should be doing. Okay? That's all under acceptance. Compassion simply means that you are with them in the moment of what they may be experiencing. You're not looking from the outside down at them in the hole. You're in the moment with them. You're offering them compassion in regard to it. You're there with them. And empowerment in an MI consistent or MI spirited way means that you are emphasizing this person's autonomy to choose for themselves. You're empowering them through inviting them to exercise their autonomy. And you may remember in the video, the second video with the dentist does the summary and then says, she summarizes what the woman said, and then she says, well, what do you think you'd like to do next? That's empowerment. Where do you think we should go next? That's empowerment. Okay, that's letting her determine. And then the woman says, oh, I really want to quit. I'd like to find out more about medications and other, options. So that's empowerment, folks, which is very different than the first dentist video, because the dentist said, so when are you going to quit? And I hope you'll think about it really hard, because it's something I'm going to keep asking you about. That's not empowerment. That's also not MI spirited or MI consistent either. And we know it's definitely not the practice of motivational interviewing. Okay? So that's what MI spirit is. Partnership, acceptance, compassion, and empowerment. You can adopt this approach, stance, relational style, whatever you want to call it. Yes, go ahead, Marissa. Go right ahead.
I just had a question, because I can't remember who was talking about working with youth, but another thing
Taryn. Yeah, Taryn mentioned that.
Oh, sorry. Okay. And I wanted to kind of ask in terms of like parental engagement or parental involvement when we're working with not just adolescents, but even younger children. How can we incorporate the MI when there's parents who are very much fixated on, okay, here's my child, go fix them. We see this a lot at our clinic. And so like, who are we really, I guess, incorporating the MI? Is it with the child? Is it with the parents? Is it with both?
I would say, and I love your question, because I would say that you have the opportunity to use an MI consistent or an MI spirited approach with both. And Marissa, would you indulge me for just a moment, and would you be a parent and say to me, here's my child, go fix them, in the way that the parent would say it? Would you take on that role for a minute and say it to me? And I'm going to respond.
Okay.
And I want to get a sense of what people think about my response.
Okay. So it usually starts off with a sentence of like, let's say it's the first meeting, like, well, do I need to be there? I mean, this is, his therapy with you. Do I like I don't know if like I don't think I need to necessarily be here. Do you need me for that?
Yeah, I mean, you're really trying to decide what's going to be best for your child in terms of whether you should be here or whether your child should have the opportunity to be able to speak to me alone.
Right. No, I know, but can he, like, do I need to be here for the very first meeting? Like, can it just be you and he? I work and I have all these other, I have other kids and they have their appointments. And so, do I really need to, because I feel like this is his therapy.
And you're concerned that, that he feels like he has the space for himself. And if it's okay with you, can I make a suggestion?
Sure. Yeah.
So my suggestion would be that maybe you and he have a conversation about that, and whatever you and he decide is certainly I would support and respect whatever decision you and he make. Any thought or any reaction to that?
Am I still being the parent or me, Marissa?
You're still the parent.
Oh, I'm still the parent. Okay. I mean, I know that he needs it. I know that he needs help. Yeah, we could talk about it, but I really feel like he needs the help. I'm getting calls from school. Like, I don't know what else to do.
Yeah, and something, you really want the best for him, and you and I are having this conversation. Maybe you and he will have a conversation, and you want to figure out what's going to be absolutely best for him so he's okay and problems don't crop up.
Okay. Well, I'll talk with him and see what we come to, and I'll let you know.
Okay, so your plan is to speak with him, and if after that conversation you'll just let me know what you've both decided, and however it turns out, I'm really looking forward to the opportunity to being able to support both of you.
Okay. Thank you.
You're welcome. So before we open it up to anybody else, let me just ask you, any thoughts, any reactions to our conversation? And then we're going to open it up to anybody else, but any thoughts, any reactions to our conversation?
I think for me, it was like, you were validating what you were hearing in terms of, you really want what's best for your child. And I mean, in my experience, that always has like kind of lowered the defenses a bit, and it does encourage the parent to be a bit more involved and kind of giving that empowerment to not just the parent, but also the child. Like, the child also has a say, which I'm also a firm believer in. That doesn't matter what age. If the child doesn't want to what if the child doesn't even want to come to therapy? Then that's something that they can, really, because I know like schools are really the ones that kind of push it a little bit more, in my experience at least. And so what if the child doesn't want to come to therapy, and we want to empower both decisions, basically. So that's kind of what I took out of it.
Fantastic. Any other thoughts? Anything that you observed? Anything that you'd underline? Anything? And Marissa, thank you so much for jumping in and being willing to go ahead, Celeste, and then we'll go to what Nikki. Did you want to say something, Celeste? No? Okay. So Marissa, thank you so much for being willing to jump in and do that. So on the spur of the moment. And Nikki writes, impressive swerve around the parent trying not to include their child in the decision. Nikki, can you say a little more about that? I'm not exactly sure what that means.
To me, it felt like the parent is just trying to push off that decision on you. Like, what do you think we should do? And they're just trying to make it like your problem. They don't want to make the choice and just let you have the expertise, and you really like navigated around that really well to put it back. I'm like, no, you and your son should figure this out.
Okay. Thank you. Thanks for clarifying. I didn't quite understand it from what you wrote. Yeah, go ahead, Taryn. What are your thoughts? What's your reaction? Oh, you muted. There
I
you go.
can't figure out how to unmute. So I agree what was like just said.
What Nikki said, yeah.
Yeah, because it's a different perspective of how I took it.
Yeah.
But immediately, like, I get that we initially kind of like restated what the parent was saying, validated the fact that they wanted and you wanted what was best for the child, but I feel like we didn't really get anywhere. Like, I was like a little frustrated by, I felt like the parent was like asking for direction, asking for help because she's not the professional. So like, my initial reaction was like, give her options, like just kind of break it down. Well, if it's consensual, you could stay, if it's consensual with the child and you, or, this isn't a daycare though, like you can't just like drop them off. Like, I don't know. I just felt like nothing was really solved. Like her questions weren't being really answered.
Okay.
That's how I felt. I don't know.
That's fine. Hey, we're in this learning community together. If that's your take, that's your take. Fantastic. Other thoughts? Yeah, go ahead, Craig.
I was just gonna say I like the way you affirmed everything she was saying, but you also and you reflected a lot of what she said, but you also shifted that accountability that was trying to be put on you back to her to resolve that issue.
Okay. Other thoughts, other reactions, because keep in mind, folks, I can't make the decision. I can't make the decision. If I had a recommendation, if I thought, it's probably going to be better for this kid if this mother doesn't come. If that's what I thought, I didn't get that impression, but if that's what I thought, I might have said. And it's interesting because I got to use an am I consistent approach / strategy, which is called offer, ask, offer, which is I said to Marissa, would it be okay if I made a suggestion? I asked permission, closed question. She said, sure. I made the suggestion, and then I asked her what she thought about it. And then I asked her what she wanted to do. So that's also a way of inviting her to make a decision. Now, if I thought that it might be better for the child to meet with me without her, and again, I didn't have that impression, but if I did, and that was a suggestion that I wanted to make, I might have said something like, I'm wondering, given what we've talked about, would it be okay if I made a suggestion? And I'd wait for her answer. And then I might say, some parents have found benefit in that when their child meets with me, that there is benefit for the child to meet with me on their own. And I'm wondering what your thoughts are about that in terms of your child. Go ahead, Sam. Go ahead, please. Go ahead.
All right, this might be a silly question, but
I love silly questions. Go right ahead.
What if you ask, can I make a suggestion? And they're like, no. Like, does the conversation just sort of stop? Like,
you don't make the suggestion.
Right.
Don't ever ask permission. Don't ever ask to offer information. And again, this is relevant to an am I consistent approach or am I spirit, as well as the practice of motivational interviewing. If you're sincerely asking somebody, and it's funny, Sam, I love the fact that this is not a stupid question, by the way, or a silly question. I love the fact that you're asking it because I don't know how many audio recordings, folks, I've listened to where the person says, would it be okay if I shared some information with you? And the person doesn't even answer, and the person launches in with sharing the information. So what I really want to encourage you to consider is, if you are going to truly invite somebody to exercise their autonomy, authentically invite them to exercise their autonomy, and you say to them, could I make a suggestion? And they say, I'd rather you didn't, or no, okay, I'm not going to make that. I'm not going to make a suggestion. Take them at their word. So Sam, that is a very important question, and we want to, of course, be practicing authentically.
Right.
So if they don't want to hear our suggestion, if they don't want to hear our information,
So then where would the conversation like go from that? We would just have to kind of feel it.
We'd have to be in the moment and feel where it went.
Okay.
Yeah. Marissa, and then we'll go to Emma. Go ahead, Marissa. The floor is yours.
I would also say, like, kind of piggybacking off whatever I say, like, parents do need to feel empowered too to make those decisions, because I think a lot of times, and I've seen it, I've experienced it a lot, where parents are coming in because the school is pressuring them, the doctor is pressuring them, some provider is pressuring them to bring their child into therapy, and some parents don't even know why, but they just follow it because there's like, oh, there must, if they're saying this, there must be something wrong with my child, or there must, like, I have to do something, or they're going to think I'm a neglectful parent, or that I don't care. There's so many things that go through a parent's mind. And so I think, empowering them to make this decision, because at the end of the day, therapy, just like any other healthcare provision, is voluntary and it's a choice. We can choose to follow recommendation or not. Same goes at a doctor's office. If you get a medication that you don't agree with, you're in your every right to say, I don't want to take this medication. Is there other alternatives?
Yeah. Yep. Emma, the floor is yours.
So I just wanted to share a little bit from my perspective in terms of working with adolescents in the school system. And there are times when I experience those same types of situations where parents want a quick fix. Maybe even other staff members in the school want a quick fix. And they don't really take into consideration what the child or what the adolescent or what the young person, however you'd like to refer to them, where they are. So in trying to do MI, where of course there are the stages of change, and then you get to that ambivalence part, it doesn't always work on a time frame, right? Sometimes it takes a while and sometimes it doesn't. And sometimes we have those parents who want that quick fix and do not, or want a report on what's happening in the process. And so as a social worker, we have to remember who our client is. And at the client for me would be the adolescent. So it would certainly have to be something that the young person agreed to. And sometimes parents don't really understand that because they are still minors and parents still have responsibility. So it gets really tricky. And we just have to I just have to find a way to try to incorporate. So what you did with Marissa in terms of asking and including her feelings and thoughts on the decision about being a part of the session was very helpful, because sometimes parents I think that's really what they want. Once you've offered it, and then it puts the ownership or the decision making back on them. And just I try to always include that young person, because bringing a parent into a session changes the dynamic.
Absolutely. So again, folks, I think the thing to keep in mind is an MI consistent approach, an MI spirited approach, partnership, acceptance, compassion, and empowerment, can really support any conversation that you're having, And I really appreciate what Emma is saying, and everything that everybody is saying, but I really want to underline something that Emma is saying, because the thing you do have to really be clear about is, who is the client? Who is the person that you're working with, if indeed there is a behavioral change goal that the person feels ambivalent about? And you're having interactions with people who aren't, quote unquote, the client, and an MI spirited approach can help you with those people. And it also, the reality is, folks, is we don't have the right to make the decision for them, because ultimately they're going to make the decision that they're going to make anyway. So it's helping them to explore their decision, consider their decision, and then ultimately they make a decision. And I'm sure there are people in our learning community who experience this. We don't always like the decisions that our patients or our clients or their parents make. We don't always agree with those decisions. We don't always like them. They're their decisions to make, though. And that doesn't mean that we may not, ask to offer feedback. And Sam, I'm thinking of you, because we might say to the person, this is the decision you've made. Would you be open to my sharing some feedback in regard to that? And the person might say no. And that means we don't share the feedback. If they say yes, and hopefully we have enough rapport with them that they say yes, we would share our feedback, and then we would ask for their thoughts or their reaction to it. And I'll go back to another very skillful moment in the dentist video. And remember, I have the benefit, perhaps the leg up on a few of the people in the learning community. I have seen the video over 700 times. So I'm glad that makes Marissa smile, that I've seen the video that many times. She says to her, earlier you had mentioned your concerns about the effects of cigarette smoking. You made a decision not to smoke. And now you're realizing that actually these cigarillos are having some of the same negative effects that cigarettes actually have. And then she follows it with, what do you make of that? What's your thought about that? And that's a double-sided reflection followed by an open-ended question. What are your thoughts about that? What do you make of that? Because it's her job to work that out, not my job as the worker. It's her job to work that out. And her first response, if we were to watch the video again, and we're not going to, but if we were to watch the video again, her first response is, I'm very concerned. I don't want to get lung cancer, oral cancer. The client says that, not the worker. That's evoking change talk. I'm very concerned. So just keeping that in mind, folks. It's not our decision to make. Thank you, Emma. We help the person to explore their ambivalence. What do you make of that? We help the person to find their motivations, and that's when we're practicing MI. No matter what the conversation is, we can still use an MI consistent approach: partnership, acceptance, compassion, and empowerment. Okay, I'm going to share my screen again and just remind you of that beautiful Venn diagram where these 4 domains overlap, and also underline something called the 4 tasks. The work that we do, and when the practice of motivational interviewing is possible, we then can practice MI, which can then lead to behavior change. first and foremost, related to an MI consistent approach and MI spirit, is that we want to engage this person. We want to try and understand them. We want to use an MI consistent approach, partnership, acceptance, compassion, and empowerment as a way to connect to them and to start to build rapport with the possible development of trust between us. And you'll see that that's the first of the 4 tasks. And you'll also see that it creates the consistent foundation for all of the other ones. Focusing is the next task. Once we've established some kind of rapport, once we've connected, we're attending on all 4 levels: eyes, ears, heart, and gut. And then we start to get a sense of what's the focus of our conversation? What's the change goal, if indeed there is one? If there is a change goal that the person feels ambivalent about, we then go to evoking. We start to evoke change talk around that change goal. And you'll remember the young gentleman who's considering cutting down the amount of weed that he was smoking on a daily basis. He was ambivalent, and we were reflecting and employing the change talk that he offered. I don't want to lose my job. I want to stay employed. I want to treat my girlfriend with the respect that she deserves. And we were evoking additional change talk or inviting him to elaborate on the change talk that he offered as a way of strengthening his motivation. And once a person has enough motivation, and I'm going to stop sharing my screen in a moment to explain to you how you know when that happens. But once the person has enough motivation, we can then move to collaborative planning. MI consistent, MI spirited planning, where we help that person to identify their plan, their actions to achieve that goal. Now I'm taking my screen down for a minute because I want to underline. We identify that a person has a behavioral change goal that they feel ambivalent about. That's focusing. We're clear on what that is. And I'm going to go back to the woman who was considering cutting down from 40 to 15 cigarettes. We know she's ambivalent about that. Part of her wants to make the change, another part of her doesn't. She shared change talk with me. I reflected that change talk back to her, and the conversation went on and more change talk came out. We could spend another 6 hours focusing on this, which we don't have, but we could spend another 6 hours focusing on just the transition from evoking to planning. But we don't have that 6 hours. So I'm going to give you the shorthand version, which is, you know that a person has enough motivation to move to planning when the following things occur. Thing 1, there is more change talk in what their client speech than there is sustained talk. So the amount of sustained talk goes down and their change talk goes up. They start talking more about their desire to make the change, their ability to make the change, their reasons to make the change, or their need to make the change. There's less reasons as to why they want to keep doing what they're doing. So that's one thing. The other thing is that they offer commitment language. They say to you, Celeste, I'm going to cut down. Celeste, I will cut down. They offer commitment language. And then the third thing is they come in and they say, Celeste, I've been thinking about this, and this is the action that I'm going to take in regard to it. They start to preliminarily identify their plan. when they offer either less sustained talk, more change talk, commitment language, or they start talking about their plan, stop evoking and move to collaborative planning. Let me repeat that. Stop evoking and move to collaborative planning. Because what I'll underline for you folks, if you keep evoking, you're getting in the way of this person's change process. Their ambivalence has decreased enough, they have enough motivation, they're ready to plan. Don't get in their way. Okay, I'm going to pause and just ask for any thoughts or any reactions in regard to that. Any thoughts or any reactions, questions or comments about the transition from evoking to planning? I know it may take a minute to sink in, so I can still pause, but any thoughts or any reactions in regard to that?
Do you need all three criteria, or is it one of the three?
Yeah, you don't. You don't necessarily need all three, but you want to be attending on all four levels to really get us that. Great question. You really want to get a sense of, is this person now ready to plan? Because I don't know if you've ever had this experience, but what can happen sometimes is we get ahead of the person and we start planning for them. And they say, whoa, wait a minute. I'm not ready to do that. Yeah, that's happened, right? Yeah, that's an indication that we need to go back to evoking. We need to go back to inviting them to talk about their desire to make the change, their ability to make the change, their reasons to make the change, or their need to make the change. Marigold writes, can you use MI when you are using another evidence-based practice? I guess my question is integrating MI with other psychotherapeutic feasibility. Is that psychotherapy is feasible? If so, when will the planning come in? Well, Marigold, fascinating and significantly evidence-based question. And I'm going to answer it by framing it this way. And Marigold's really on to something here. MI plays very well with others. And what I mean by that is that it works really, really well in conjunction with other modalities. And where the planning would come in, it's hard to say because it depends on the other modalities. But where the planning would come in, again, is when you have the indications that ambivalence has reduced enough. It doesn't go away completely, but it's reduced enough. And there's enough commitment. I'm not sure how familiar people are with the MI research because there's actually tons of it. There are thousands, and I'm saying in the thousands of clinical studies that confirm that when a person starts to offer commitment language, and not commitment language where they're just yesing you, but where they actually believe it and they have enough motivation behind it, when that person starts offering commitment language, that's the biggest indication that this person is actually going to move toward that change, where they're actually going to start taking steps and actions, meaning that they have a plan that they're following. So Marigold, to your really excellent point, yes, MI integrates very well with other methodologies, and there's actually research that and Dr. Miller Bill Miller, one of the creators of MI, is very excited about that, to find that it works really well with other modalities. And frankly, I think partly the reason that it works so well with other modalities is that at its heart, motivational interviewing is person-centered and trauma-informed, because it centers the person. It affirms their autonomy. It emphasizes their strength. Okay? So just keeping in mind about the transition. And if you find that a person is not ready to plan, just go back to evoking, inviting them to talk about their desire to make this change, their ability to make the change, their reasons to make the change, or their need to make the change. And by the way, that spells darn, D-A-R-N. And that's how you can remember it. Okay? And the research also shows that the more the person does that, the more they talk about their desire, their ability, their reasons, or their need. And let me underline something, folks. They have to say it, not you. If they say it and then you employ it, you're strengthening their motivation. But they have to say it. And I'm going to go back to the 2 dentist videos for a minute. In the first dentist video, that is, am I inconsistent and not the practice of MI, the dentist says, you need to stop. You could get cancer, oral cancer, lung cancer. The dentist says it. In the second video, the patient says it. The patient is the one that has to verbalize it. And then the dentist employs it. The dentist affirms it, reflects it, includes it in a summary, and invites elaboration about it. Okay? And that is very different. You may have 10,000 reasons why this person needs to make this change, and that's great. You care. That's wonderful. But if that person doesn't share those 10,000 reasons, if they don't say them, if they don't have any meaning for them, it's not going to help motivate them to make their change. In fact, they may feel pressured if you shower them with your 10,000 reasons why they should change. Okay? So just keeping that in mind. I'm going to share my screen again. And I want to just touch on, and this is the thing that most MI trainings focus on for most of the time. That has not been the case with us as directly as it is with other trainings. The core communication skills, open-ended questions, questions that cannot be answered by yes or no, affirmations, usually starting with the word you, and identifying strengths or efforts that the person is making in regard to the change, reflections that end in a period, and summaries that are usually composed intentionally and selectively of change talk and handed back to the person as a way to strengthen their motivation. I want to repeat and underline for everybody. Simply using these skills is not the practice of motivational interviewing. I'm going to repeat that. Simply using these skills is not the practice of motivational interviewing. These are communication skills that we all use every day. Bill Miller and Stephen Rolnick did not invent these. They did invent the catchiest acronym, ORS, as a way to remember them. It becomes the practice of motivational interviewing when you're using these core communication skills specifically focused on an identified behavioral change goal that the person feels ambivalent about. And you are evoking change talk, or you are employing the change talk that they've offered. I'll give a very concrete example. If I was to say to the young gentleman who was considering cutting down weed, if I was to say, the change you're considering is cutting down the amount of marijuana that you smoke on a daily basis. You're considering that at this particular point because you want to stay, bless you, Jonathan, you want to stay employed, and you also want to treat your girlfriend with the respect that she deserves. That's a summary of the change talk. It's selective and it's intentional. And it's meant for that young gentleman to hear what he said again and to think about what he said again. Because he might say, I might then follow that with, did I get that right? And he would say, yeah. Did I leave anything out? No, those are the two major reasons. Is there anything you'd like to add? He might say, well, you know, weed is getting expensive and I need to have better management of my money. Therefore, if I smoked less weed, I'd probably have more money that I could use for other things. That would be evoking more change talk. So in addition, so then I would employ that. So in addition to wanting to stay employed and treat your girlfriend with respect, you also want to make sure that you have enough money to do the other things that you want to do. That's employing the change talk. Okay? It's selective, it's intentional, and it's technical. And it is structured, as we started with that idea that it's structured. It's structured. Okay? So that's part of the practice. I want to touch on one other concept for us together. And then I have a brief video that I want to show you. And then I think we're going to be at the end of our time. So I'm going to show you the final slide and then you can complete the evaluation. But the other concept that I want to touch on, and I'm going to share my screen to do this, is I want to touch on this concept of the fixing reflex. And I'm going backward to do that, which is this notion that's, and I'll show that again in a minute, but sometimes as providers, when the client shares their ambivalence with us, and I'm going to make an I statement here, okay? Sometimes I, as a provider, when I hear the client talking about, quote unquote, their ambivalence, a switch gets turned on in me and I want to jump in and I want to spare the person. I want to fix the situation. I want to tell them what they need to do in order to solve the problem. Miller and Rolnick call that the fixing reflex. I could be the only person in this learning community who has that. But Jonathan is shaking his head no, so maybe Jonathan and I have it. I don't know. It could be just the two of us. But what I can honestly tell you, and Jonathan, I don't know if you've had this experience, but what I can honestly tell you, folks, is that has never left me. Marigold, what were you going to say? No? Nothing? Okay. Do you have the fixing reflex too? Okay, so it's Marigold, Jonathan, and I, and also Taisha has it as well. So what I can tell you, folks, is that has never left me. What I have learned, though, is I have learned not to act it out. I have learned how to manage it. I can put my hand down now, I guess. I have learned how to manage it so I don't act it out. The thing I want to normalize, though, folks, is that switch gets flipped because we care. We want better. We want to help. We care. And I'm going to go out on a limb and say this. You may strongly disagree. And if you do, I'm open to hearing it. But I'm going to go out on a limb and say this. I believe that the dentist in the first video, I believe she actually does care. But, and again, you may not agree with me. I believe she does care. And I do think that her caring has really flipped her fixing reflex switch. And sadly, she cared so much, she alienated the patient and potentially lost the patient. So It's normal to have it if you have it. So thank goodness we find out we're normal, Jonathan. Marigold and you and I and Taisha are normal. We have it. We can learn how to manage it. So I'm going to share my screen again. And just underline, folks, that we don't have to act it out. It's normal that we have it. We don't have to act it out. And there's a great acronym that can help us when that switch gets flipped. And that is let RULE, R-U-L-E, guide you. Miller and Rolnick love acronyms. RULE, resist the fixing reflex. Don't act it out. U, understand your client's motivation. So put your energy away from fixing into, I'm trying to understand this person's motivation. I'm trying to understand where they're coming from, that accurate empathy. And then we can do that. And I'm thinking, I think it was Craig who said this, the idea of this active listening. We can listen, we can actively and intentionally listen on those 4 levels to what this person is telling us. And then we can always go back to, with an MI consistent approach and MI spirit, as well as the practice of MI, of empowering this person to exercise their autonomy. They get to make the decision, not us. So RULE, resist the fixing reflex, understand your client's motivation, listen to your client, and empower your client. It is normal, completely normal, to want to jump in, fix, solve, rescue, and help. Don't do it. Try and hold back from doing it if you can. I'm going to share my screen one more time. I'm going to go forward a bit. I wanted to make sure we covered that. And remind you that when we are practicing motivational interviewing, we are guiding the conversation. There is a direction, and that's different than just client-centered counseling. There is a direction in the conversation, and we are guiding toward the behavioral change goal. It is not directive. If we are telling people what to do, we've crossed into, am I inconsistent or am I incongruent behavior? When we practice motivational interviewing, we're not telling people what to do. We're directional, we're not directive. MI does have a North Star. The practice of MI has a North Star. Once we focus, once we identify that behavioral change goal, everything we do after that is guided and focused on that behavioral change goal. When we're practicing motivational interviewing, again, to practice MI, there needs to be a behavioral change goal that the person feels ambivalent about so that we can explore their ambivalence and evoke their motivations. The behavioral change goal is the North Star. It guides, provides us direction with everything that we do when we practice motivational interviewing. We've already looked at the second video. We've identified very clearly that change talk is anything that that person says, and we've talked about this in far greater detail than was ever intended for this 6-hour training. And I'm glad for that. And that has everything to do with our learning community, which is fantastic. Change talk is anything that the person says in favor of the identified behavioral change goal. Remember, it's one side of the language of ambivalence. And if anybody remembers the name of the other side of the language of ambivalence, type it into the chat. If you remember, there's change talk, and on the other side of that language, there is another kind of talk. Let's see, 4 people have responded. Let's see if anybody remembers. Yes, it's sustained talk. Absolutely. And if you didn't remember that, feel free to copy what the people in the chat put. It is sustained talk. Both are normal. In MI, we want to feed the practice of MI, we want to feed the change talk dog. We want more change talk, because the more change talk there is, the more likely the person is going to move to commitment language and then possibly planning. And change talk truly is the key. It's gold. It's the key to the effectiveness of motivational interviewing. I'm going to stop sharing my screen for a minute because I want to underline something here. Change talk can occur naturally. Person can just, as they're talking to you about what they're considering, they might naturally just share with you their desire, their ability, their reasons, their need to want to make this change. That's what I would call naturally occurring change talk. What I want to invite all of you to consider is you don't have to wait for naturally occurring change talk. You can evoke change talk. And I'm going to give you a concrete example. Let's say, just for the purposes of our discussion, Jose had a behavioral change goal of reducing the amount of French vanilla creamer he was using in his coffee. Now, this is entirely a projection on Jose, because that truly was a behavioral change goal of mine. So Jose, if you don't mind, I'm going to project that on you for a moment, if that's okay. So let's say that was Jose's identified behavioral change goal. I could evoke change talk by employing an open-ended question. And let me give an example. I could first ask Jose's permission to ask him a question. So Jose, is it okay if I ask you a question?
Yes.
Thank you. So Jose has just granted me, Sam, he just granted me permission to ask a question. So the open-ended question, and I know that this is not Jose's behavioral change goal, but a simple open-ended question that could evoke change talk as opposed to waiting for it to naturally occur is I could say, Jose's given me permission. I could say, Jose, when you think about this change that you're considering of cutting down the amount of French vanilla creamer you're using, what are the 3 top reasons that are causing you at this particular moment to consider this change? That's an open-ended question, folks. However Jose answered that, and I'm going to answer it. I'm going to pretend that I'm Jose and I'm going to answer it. 1, well, my clothes would fit better. I would be decreasing the amount of sugar that I was taking. And to be honest, if my clothes fit better, I'd feel better about myself. Now, I/Jose just offered you a boatload of change talk. Boatload. Let me ask you to type the following letters in the chat and type them together. It's a word. EARS. Type that into the chat. EARS. Ears. The reason I'm asking you to type that into the chat, folks, is we've just offered a boatload of change talk. Don't ignore it. Don't leave the money on the table. Ask for elaboration. E. What are some of the other reasons that are causing you to consider this change right now? Invite elaboration. Affirm it. You're committed to good health. Affirming my commitment to good health. Reflect it. You're considering this change because you want your clothes to fit better. You want to eat less sugar and you want to feel better about yourself. or include it in a summary. You know, as we've talked about this, these are the things that you've identified and you list them again. Okay? Don't leave money on the table. You don't have to wait for change talk to occur naturally. You can evoke it. And once you get it, put it to work, employ it. Don't leave money on the table. If you do, if you ignore that boatload of change talk, you're undercutting the power of the practice of motivational interviewing. Okay? It's his change, our change talk. You don't want to ignore it. So just consider that. And you can remember ears, elaboration, affirmation, reflection, or summary. It's very much like oars. But ears, we're applying it directly to change talk. I'm going to share my screen again. And change talk truly is gold, and it is the key. All right, we're not going to look at that scenario because I do want to show you this brief video. So I've made the executive decision of not sharing that Conrad scenario with you. I'd like to show you this video instead, and I'd like to get your reactions to this video. I do want to go back to a point, though, that we did discuss in part 1, because it's relevant to our learning community, which is the questions versus reflections ratio. When we are practicing motivational interviewing, folks, we are trying to do more reflections, less questions. I'm going to repeat that. When we are practicing motivational interviewing, we are trying to do more reflections, less questions. It doesn't mean that questions aren't of use or value. We do use them. We use them intentionally. We use them specifically. We use them to evoke change talk. We do want to try and do more reflections than questions. And the reason for that, folks, is that we want to communicate our understanding to the person, and we want to employ their change talk. And reflections are a great way to employ the change talk. So I just wanted to underline that, especially for our learning community, because we did talk about the reliance on questions and people. Well, actually, I'm going to take my screen down for one more moment. I want to share one very brief story with you. Bill Miller, one of the creators of MI, was asked once, Bill, if there was one thing you could change about motivational interviewing with all the research that's been done and everything that you know, if there's one thing that you could change about motivational interviewing, what would you change? He paused. He's a very thoughtful person. He paused and he said, I'd change the name. I'd call it motivational conversation, not interviewing, because interviewing implies, Marissa, where were you on the night of June 6th? It implies questioning. I'm going to interview you. It's a conversation. The creator of this evidence-based practice himself said, I changed the name. I'd call it motivational conversation. So more reflections, less questions. Help conversation. I'm going to share my screen one more time. And the idea, you've seen me do it a number of times, and this is so related to what we were talking about earlier. Asking permission is a way of supporting somebody's autonomy. It's also a way to continue the conversation. And I will underline, as we talked about, the authenticity. Do not ask somebody, can I share some information with you, if you are not going to respect their answer. If you're not going to respect their answer and you absolutely must share this information with them, don't ask permission. Just do it. It's am I inconsistent in terms of an am I consistent approach? It's not respecting their autonomy, but at least it's authentic. So just being very clear that if you're going to ask somebody permission, let them answer and honor their answer. Important thing to keep in mind, and this I think is going to be a nice transition into the little video I'm going to show you. If you're talking with somebody and you're noticing, wow, there's a lot of sustained talk coming up about the targeted behavior change, just like in that first dentist video. The patient just started offering more and more sustained talk because the dentist kept telling her what she needed to do, which was to quit. So the more the dentist told her she needed to quit, the more the patient said, well, I don't need to quit because of X, Y, and Z, or it's not really that much of a problem. So if you're hearing more sustained talk, or if you notice that you were engaged with the person, but all of a sudden you're not, ask yourself, is there something I'm saying? Is there something I'm doing right now that could be evoking sustained talk or creating discord or a diminishment of the engagement? And you all remember the gesture, I'm going to do it, you don't have to, but I'm going to do it for you. Hopefully you can see me. And if you see me do this after I do it, type a Y in the chat, but you can always course correct. Now, if you saw me do that gesture, type a Y in the chat. I'm going to do it again in case you didn't see me the first time. You can always course correct. Did you see it? Were you able to see me do it? One person has responded. 2 people have responded. Okay, good. So people could see me do it. You can always course correct. And you can simply go back to engaging and trying to find out more from the person. And that it is possible to course correct during the MI conversation. Now, having said that, folks, I'd like to, just before we end, I'm going to try and give you a few minutes to complete the evaluation. But yes, plot twist, absolutely. What I'm going to share with you now is a brief video from the movie Inside Out, not the new one that's out, but from the old one. And I'm going to show you this brief clip, and then I'm just going to ask a couple of people to unmute and share their reactions or what they take away from seeing this little clip as it relates to the practice of motivational interviewing and an MI consistent approach. So I'm going to show you the clip, and then I'm going to just invite a couple of people to unmute and share their reactions. Okay? And Sam, if you don't mind, would you be willing to unmute first?
Sure.
Fantastic. And again, if you draw a blank, if you don't have any reaction or thought, you can pass. But
Okay.
if you do, so how this clip relates to MI consistent approach or the practice of MI. And then maybe, Sam, if you do share a response, then maybe we can also hear from Emma, if Emma's okay with that. And Emma, you can pass if you don't want to, and then if anybody else wants to. So here comes a little clip. I'm keeping my fingers crossed that the magic of Zoom is going to work.
My rocket! Wait, Rally and I... Oh, the stuffed animal Hall of Fame! My rocket! Wait, Rally and I were still using that rocket. It still has some song power left. Who is your friend who likes to play? No, you can't take my rocket to the top. Riley and I are going to the moon. Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Bing bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time. We had breakfast twice that day.
Sadness.
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
How did you do that?
I don't know. It was sad, so I listened to what.
Hey, there's the train.
Sam, any thought, any reaction?
First of all, one of my favorite movies. But I remember the first session, I think when I said, am I spirit, I said something to the effect of positive energy. So it was interesting that Joy is obviously by nature very positive. But her, what did we call it? Fixing reflex was showing. And it just kind of shut him down, where then Sadness came over and actually listened and had the eyes, ears, heart, gut going, and they had that breakthrough really fast.
Sam, it's so unfortunate that you had nothing to say about that, but thank you so much. Emma, the floor is yours.
So I just started thinking about, there was a question earlier today about combining two different types of therapy.
Yes.
And
Marigold asked that, I think. Yeah.
Yeah, and so that's what I thought about. There was some grief counseling going on, therapy at first to get the elephant moving and out of the funk, or so to speak, so to grieve the loss. And then he was able to get up and keep it moving, and then he was better. So when I think about MI and thinking about if a person is not ready, are they still really ambivalent? Are they still in the pre-contemplation, contemplation stage? Invoking a different type of evidence-based therapy could also help move that person along.
Fantastic. Thank you so much, Emma. Any other final thoughts about, or any other comments that people would want to make about why I shared that little clip with you?
I had a little comment, Paul.
Please,
I have a 4 and a 6-year-old, so we watch this movie at least once a day, but I never noticed that clip. And it's so cool to just watch that sadness emotion meet Bing Bong where he was at. But then this part I just realized, she also matched his energy. So, she was just meeting him where he was at on different levels.
Yes.
Yes. So that was really cool to watch.
Thank you, Celeste. And Celeste, what you're really identifying also is it's a beautiful demonstration of accurate empathy. Because yes, she matches his energy. She's with him in that moment. She's not trying to make the moment go away. She joins him in the moment. Folks, I cannot thank you enough for your participation over this 6 hours. I really appreciate everything that you brought to the learning community. And I'm very hopeful that I'll have the great opportunity to be in a learning community with you in the future. So thank you so much for being here, and have a wonderful and safe weekend when it gets here. And look forward to seeing you again soon. Thank you so much, everybody.